health principle for so long, but often we meet in our silo as health experts or practitioners and somehow behave as if the rest of the sectors will organically come around us. So thank you once again for making it happen that within the room we have the other sectors that are so critical to the issues that will be of importance in containment of the various outbreaks and other calamities that will come up. Thank you so much, and I look forward to fruitful deliberations.
Thank you so much, Professor. And now calling upon our host for this morning, Dr. Kuria, who's the director of a National Public Health Institute, to give some opening remarks. A round of applause for him.
Good morning, everyone. Let me start by apologizing for coming in late. There's something urgent that came up, but I would have wished to start the meeting with you as you are doing your introductions, because I like the remarks made by the last speaker that we have in our midst, several experts from different sectors who Africa CDC has found fit to bring together in one room. And correct to say that we in the health sector would imagine that others in the other sectors would organically come towards us during crisis. So this is a wonderful opportunity. So to my colleagues, again, I stand here. My name is Dr. Francis Kuria. I head the Directorate of Public Health in the Ministry of Health and double up as the Acting Director General of the Kenya National Public Health Institute, which is a fairly young institute, so that most of the work that has been done in this country on event-based surveillance have been done by the Directorate rather than by the Institute. So on behalf of the Cabinet Secretary, Ministry of Health, and the Director General for Health of this country, would have wished to be with us this morning, but due to exigencies of duty, we are not able to join you. I bring you greetings from those two higher offices. And on their own behalf, I wish to welcome all of us who are here to Nairobi, to Kenya. For those who are visiting Nairobi for the first time, you may have noticed it is fairly calm today. Traffic might be light. Kenyans are exercising their democratic rights. It will be over towards evening, and we'll be back to the busy city that we are used to. But I can assure you, while you're in the room here, you are safe. Kenyans just love democracy, and they are enjoying it at their fullest. But it will not stop us from doing what we do. Event-based surveillance will continue. Nairobi still remains the very beautiful city in the sun. And many may have told you, you have Googled as you came in, the meaning of the word Nairobi. Nairobi means cold water. This is after one of the communities who live around Nairobi. They are pastoralists. They love green pastures. And I noticed a place, before the railway crossed over the city, it used to be a swamp, and it used to be a source of some very cold water for the animals that the Maasai used to live, to enjoy. So it's called the place of cold waters. That's Nairobi. It has been fairly dry. We're starting to experience some rains. You may get some storms in the evening, but again, all will be well. So to my colleagues from the US Africa CDC, the distinguished directors from the National Public Health Institutes, our distinguished partners from the African member states, and technical experts from the various sectors in those member states, our dear partners and colleagues, the WHO Afro, US CDC, and all other partners represented here, and all protocols observed. Again, good morning. I'm also pleased to join you at this very important event for the launch of the Africa CDC event-based surveillance resources. And again, let me thank the Africa CDC for organizing this workshop in Nairobi, Kenya, where the Africa CDC Eastern Region Coordinating Center has been hosted since 2017. I would also like to congratulate the Africa CDC for the great work done in developing these resources, as they will enable all African Union member states to strengthen their early warning and response systems. And this is in line with the Global Health Security Agenda and the Africa CDC mission, which is to strengthen the capacity of member states to detect, prevent, control, and respond quickly and effectively to disease threats. As mentioned earlier, we are aware of the threats that Africa continues to face. Even in this country, I was mentioned, we are also responding to cholera, and being close neighbors to Tanzania, our alerts are high, as Marburg is just next to us, and we've just heightened our surveillance systems at the near port of entry, which is just a boat away from Kenya. Allow me to say a few words about the progress made on EBS in the Republic of Kenya, where Kenya was one of the first countries supported by Africa CDC on events-based surveillance since 2018. And the Republic of Kenya now has established EBS guidelines, and we have trained over 500 surveillance officers, both at national and sub-national levels, to improve and timely detect and report public health events. We had even tried to tailor-make this when we were dealing with COVID and have a school-based surveillance system that we were about to launch when COVID cases started going down as an improvement of the event-based surveillance. I'm sure as part of the experiences given by member states, my colleagues from the Directorate of Public Health, you give our experiences with rolling out EBS and the training and how useful it has been in detecting few outbreaks in this country. As you are all aware, the most important strategic objectives of public health is the control of disease outbreaks and health events. In addition, event-based surveillance is a critical component of that early warning and response system as recommended by the WHO and to meet the requirements of International Health Regulations 2005. And no country is immune to outbreaks and crises, and many African Union member states continue to experience recurring epidemics and major public health events. In addition, the COVID-19 pandemic has highlighted the urgent need to strengthen the EBS component of the national surveillance system. Ladies and gentlemen, as we know, these epidemics and public health events have significant impacts on health and economic development. And strengthening early warning and response, we reduce not only morbidity and mortality, but also prevent disability and also reduce the socio and economic impacts resulting from these events. We need to urgently step up and close the gaps in the early warning and response systems through the implementation of these EBS resources. Noting that the use of these resources that have been developed by the Africa CDC, member states will be able then to facilitate the detection and the timely reporting of public health threats within and across AU member states, and therefore strengthen early warning and response systems on the continent. I want to thank all the AU member states and partners for their immeasurable support, and Africa CDC again for organizing this very important historic event for the continued support to the AU member states. I look forward to a very productive meeting and the dissemination of these resources, which would have a positive impact on surveillance and response systems in member states. I also hope that this meeting will bring renewed commitments by member state partners and all stakeholders present to invest in improving epidemic intelligence across the continent. Kenya is committed and remains committed to working with the Africa CDC and other partners to improve its surveillance system by adopting and implementing these EBS resources we are launching today. Once again, allow me to thank all our partners present here, starting from whoever is sponsoring here, the Africa CDC, the US CDC, the East African Health Community, and all other partners present here for the support you've continued to give both to us as CDC and to us as a country as we implement EBS. Recognizing, as we talk about outbreaks here, recently I was invited by the Republic of Uganda, which is represented here by the Director General of the National Public Health Institute, to take part in the after-action review for Ebola virus disease that they managed to control in a record 69 days. And I think one of the things that arising from that was the use of event-based surveillance as a very effective tool in reducing the detection time. And I think as they give their experience also, we may learn more of the usefulness of these EBS systems in disease detection. So once again, I thank all of you and welcome you to Nairobi, welcome to Kenya. And with those few remarks, on behalf of the Cabinet Secretary for Health, Ministry of Health Kenya, wish to declare this meeting officially opened. I thank you all.
Thank you so much, Dr. Kuria, aptly representing the Ministry of Health. It's very nice to get a history lesson and weather update in opening remarks. I don't think I've heard that before. Now moving on to the next segment of the program, I'd like to re-invite Mercy, who will take us through the objectives of the meeting, and after which we will move on with the program.
Thank you, Victoria.
I beg your pardon. So to spare you the projection, our key guests, you may take your seats. Thank you so much. And Mercy, the floor is now yours.
Thank you. So we need the slides up, kindly. Oh, thank you. Good morning again, ladies and gentlemen. So I'm going to take you quickly through objective of the launch. Just a quick overview of the journey of event-based surveillance in Africa CDC. Like Dr. Yunyu had initially mentioned, Africa CDC went fully operational in 2017. And the mission of Africa CDC is actually to strengthen national public health institutes or equivalent institutions within the country to be able to detect, prevent, respond promptly to public health threats. So that also guided Africa CDC in prioritizing event-based surveillance as one of the very key instruments towards improving early detection. So in 2018, the first version of the Africa CDC event-based surveillance framework was launched. And as you can see, in 2020, there was the onset of the COVID-19 pandemic in Africa. We had the first case reported in Africa in 2020. And again, we learned a lot. There was a lot of lessons that came out from that. One of the very key issues that we were looking at was how do we ensure that capacity does not rest only at the national level, but we are able to have countries establish systems across the sub-levels that are able to help these lower levels to detect also and respond promptly. So that is also one of the very key lessons that we learned during COVID-19. And we began incorporating some of the outcomes of this in 2021. And by 2021, by the end of 2022, we've had the consolidated version finalized, thanks to a number of partners in here. So basically, we are here today because the document has been finalized. I just mentioned just the Africa CDC framework, but as we all know, we have a number of resources that we are currently launching concurrently. We have the event-based surveillance framework, we have the training model, we also have the health information exchange policy and guidance that we also be launching, and our flagship initiative, which is the event management system. So basically, that is what we'll be doing tomorrow, because we're going to, let the cat out of the bag tomorrow. But we'll be, listening to some of the presentations and some countries will be showcasing some of the success stories of the impact of implementing this first version that was developed. Again, we were looking at establishing or launching our community of practice, our continental community of practice. Like Dr. Yenyu mentioned during his presentation, we have 3 community of practices within the regions that are being operationalized. We have one for the northern region. We also have a community of practice established for the southern region, and then we also have one for the central region. But again, we're looking at a continental picture whereby we are able to cross-share information as member states. We are able to verify these signals that have been detected, and we're able to support each other, share resources towards to improve our response as a continent. Just as it was said, we are strong as our weakest link. So we definitely have to look at how we approach this, not only as regions, but from a continental perspective. So the expectations for these 2 days, as shown, we want to ensure, or we are looking forward to ensuring that all participants have some sort of clarity on the strategies and strategic objectives, to be more precise, and all the other initiatives within the Epidemic Intelligence Program of Africa CDC. So by the end of these 2 days, you should be able to know what, as Africa CDC Epidemic Intelligence Program, what we can be able to offer you as a members, as a technical institution. Secondly, we also want to ensure that by the end of these 2 days, all partners and member states are aware and have access to the available resources that we've developed. It's one thing to develop these resources, it's another thing to get it implemented or domesticated. So we are looking forward to you having access to these resources. I know a number of member states have approached us to ask where these resources are housed. Then that would defeat the very purpose of the launch. So we would let these resources out on Wednesday, and we promise we're going to let it out on time. So immediately after the launch, or that same tomorrow, at the end of the session, we are going to put the link out there, and you'll all be able to access, and hopefully go back with the hard version. Again, while we had everyone to sit in this manner, whereby we are not respecting countries or region, was to ensure that we are able to meet, greet, exchange, and also improve our collaboration, get to meet other focal points that you can also reach out to for more information should you need. So we are hoping that at the end of this 2 day, we are aware, and we have met people within our regions that we feel are also very relevant to the work we do. So in the room, we have a number of participants here and very diversified. We have directors of National Public Health Institutes. We have directors of surveillance and response divisions. We also have the event-based surveillance focal points. And we also have regional economic communities represented. We have other AU organs here, like the AU IBA. And we have a number of partners that are in here. Apologies if you are not reflected, but know that your work actually is speaking on your behalf. So we really applaud all the partners that have really demonstrated resilience in ensuring that we build robust systems, early warning systems for the continent. So this is it for my presentation, and hope you enjoy your tea break. Thank you.
Thank you so much, Mercy. As she said, we are heading into the tea break. We are going to allocate, I believe, 20 minutes to that, and we are right on schedule. It is 10:30 now, so a request to be back in the room by 10:50 so we can get into the presentations of the day. You can head out, get some tea, some bitings, and be back in the room. Thank you so much.
know which disease we are dealing with.
Locally, we were producing personal protective equipment, we were producing nose masks, we were producing sanitizers. We were shocked at the level of innovation that Ghanaians had when it came to producing stuff for COVID-19.
The fourth pillar is domestic resources. And this means that we need to go into the new space where our government, our private sector, and members of the public are part of the resources that we are going to be actively using in planning for and responding to any disease threats and health emergencies on the continent. The fifth and last pillar is partnerships. We know that we must do this on our own as Africa, but it doesn't mean that we're going to do it alone. We invite and encourage partnerships.
The way we do partnership also determines the way we act and the way we operate. When we come here as Africa CDC to support the government of Uganda, we follow the way they drafted the technical documents, plans, procedures. That is what we follow. I think this has given the leverage, like a respectful partnership with the government as well as all other actors in the country that we are closely working with.
Africa CDC's work is a marathon and a relay at the same time. There are those who begin, and then they hand over to those who will come.
Africa CDC has done quite a lot within just 6 years, and I feel like we have the potential to do even more. The past and the current leadership have embedded in all the staff what the institution is looking at attaining, and I think we are all conversant about what we need to do.
And like honestly, I would attribute it to proper teamwork from the previous leadership to the incoming leadership, that you can tell these are people that have been working together. The communication lines were so much open such that in as much as there's been changes in signatures, but when it comes to the operationalization and the work happening on the ground, there hasn't been much difference.
Even more support from you as member states.
So thanks to each and everyone at Africa CDC, from the top to the bottom and from the bottom to up.
So to our member states, continue to support us. Your trust is important, but your support is also welcome so that we as Africa CDC can meet our mandate for the continent. To our partners, I am encouraging them to work even more closely with Africa CDC. We want to work with partners based on the vision of the new public health order, respectful partnership of our priorities, and action-oriented so we deliver results for the continent and for public health. To our staff, my message is very good work that we have done. Let's continue to do it, and let's do more and even more efficiently. At this point, we are now deciding how efficiently can we reach that point that we want to.
We've been able to recruit and train 100 young people to be championing the COVID-19 vaccination in the community.
We have engaged 49 of the 55 member states, and we've been able to support the uptake of 11 million vaccine doses.
Within this Bingwa initiative, we also came up with the idea of organizing a youth pre-conference on the margin of CFIA 2022. One of the most important outcomes of that youth pre-conference in Kigali was the decision to establish a technical team for young people to advise the director of Africa CDC on how to engage young people on the continent when it comes to health issues.
We've not been very good at blowing our own trumpets. As public health professionals, we are so focused on delivering the work that we are assigned to do that we don't pause to tell our own story.
Our stakeholders, starting with our presidents, our Honorable Excellency, we want to say the wisdom you had in creating this organization has paid off to have a continent-wide health security agency.
Africa CDC has come a long way in 6 years. We have ensured that the continent is coordinated in its planning, in strategizing, and in response. This has given us the very important trust from our member states, our partners, and members of the public.
Our work is guided by, a strategic plan. We articulate the African Common Position to promote health, security, to ensure that Africa is not left behind when we will face a new epidemic or a pandemic.
In the last 6 years, we have managed to do the work in a very coordinated manner with our member states. We have managed to deliver results at the same level, if not more, than well-established institutions that were dealing with this matter before Africa CDC came into being.
It is unfortunate that we have lost some soldiers during this fight.
Africa CDC is envisioning a new situation for health security on the continent through the vision of a new public health order.
Africa's new public health order is all about having strong national public health institutions that will serve as a reservoir, a memory for whatever intervention that is done on the continent.
As Africa CDC and as African Union, we continue to provide that platform that allows for coordination between the different government sectors.
We strengthen them through technical capacity and capability as an institute for that specific member state or country.
Through the support of Africa CDC, it has also strengthened our core mandates. That is one, to conduct our research into disease of public health importance, support Ghana Health Service with their surveillance and monitoring activities.
Strengthening these institutions ensures that the continent has very important coordinating bodies, and the country has a very important coordinating body that is going to provide guidance when there are health emergencies and disease threats.
When you look at workforce development, it's number 2 on that list. Today, we know that there are several partners.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements.
Contributes to the quality for our lab to be accredited. One of the things that I'm also excited about this partnership is that by building our capabilities, we'll be able to build capacities even in different institutions within Ghana and across West Africa.
We must manufacture our own health products for us to be able to respond efficiently and effectively to any disease threat and health emergency on the continent. These will include the most simple things like masks and gloves, and it will also include the more complex things like therapeutics and vaccines. And this includes also diagnostics that we need to ensure that we know which disease we are dealing with.
Locally, we were producing personal protective equipment, we were producing nose masks, we were producing sanitizers. We were shocked at the level of innovation that Ghanaians had when it came to producing stuff for COVID-19.
The fourth pillar is domestic resources. And this means that we need to go into the new space where our governments, our private sector, and members of the public are part of the resources that we are going to be actively using in planning for and responding to any disease threats and health emergencies on the continent. The fifth and last pillar is partnerships. We know that we must do this on our own as Africa, but it doesn't mean that we need to do it alone. We invite and encourage partnerships.
At this point, we are now deciding how efficiently can we reach that point that we want to go.
We've been able to recruit and train 100 young people to be championing the COVID-19 vaccination in the community.
We have engaged 49 of the 55 member states, and we've been able to support the uptake of 11 million vaccine doses.
Within this Bingwa initiative, we also came up with the idea of organizing the youth pre-conference on the margin of CFIA 2022. One of the most important outcomes of that youth pre-conference in Kigali was the decision to establish a technical team for young people to advise the director of Africa CDC on how to engage young people on the continent when it comes to health issues.
We've not been very good at blowing our own trumpets. As public health professionals, we are so focused on delivering the work that we are assigned to do that we don't pause to tell our own story.
We're so much open such that in as much as there's been changes in signatures, but when it comes to the operationalization
To our stakeholders, starting with our presidents, our Honorable Excellency, we want to say the wisdom you had in creating this organization has paid off to have a continent-wide health security agency.
Africa CDC has come a long way in 6 years. We have ensured that the continent is coordinated in its planning, in strategizing, and in response. This has given us the very important trust from our member states, our partners, and members of the public.
Our work is guided by, a strategic plan. We articulate the African common position to promote health, security, to ensure that Africa is not left behind when we will face a new epidemic or a pandemic.
In the last 6 years, we have managed to do the work in a very coordinated manner with our member states. We have managed to deliver results at the same level, if not more, than well-established institutions that were dealing with this matter before Africa CDC came into being.
It is unfortunate that we have lost some soldiers during this fight.
Africa CDC is envisioning a new situation for health security on the continent.
Within this Bingwa initiative, we also came up with the idea of organizing the youth pre-conference on the margin of CFIA 2022. One of the most important outcomes of that youth pre-conference in Kigali was the decision to establish a technical team for young people to advise the director of Africa CDC on how to engage young people on the continent when it comes to health issues.
We've not been very good at blowing our own trumpets. As public health professionals, we are so focused on delivering the work that we are assigned to do that we don't pause to tell our own story.
To our stakeholders, starting with our presidents, our Honorable Excellency, we want to say the wisdom you had in creating this organization has paid off to have a continent-wide health security agency.
Africa CDC has come a long way in 6 years. We have ensured that the continent is coordinated in its planning, in strategizing, and in response. This has given us the very important trust from our member states, our partners, and members of the public.
Our work is guided by, a strategic plan, we articulate the African common position to promote health, security, to ensure that Africa is not left behind when we will face a new epidemic or a pandemic.
In the last 6 years, we have managed to do the work in a very coordinated manner with our member states. We have managed to deliver results at the same level, if not more, than well-established institutions that were dealing with this matter before Africa CDC came into being.
It is unfortunate that we have lost some soldiers during this fight.
Africa CDC is envisioning a new situation for health security on the continent through the vision of a new public health order.
Africa's new public health order is all about having strong national public health institutions that will serve as a reservoir, a memory for whatever intervention that is done on the continent.
As Africa CDC and as African Union, we continue to provide that platform that allows for coordination between the different government sectors.
We strengthen them through technical capacity and capability as an institute for that specific member state or country.
Through the support of Africa CDC, it has also strengthened our core mandates. That is one, to conduct our research into disease of public health importance, support Ghana Health Service with their surveillance and monitoring activities.
Strengthening these institutions ensures that the continent has very important coordinating bodies, and the country has a very important coordinating body that is going to provide guidance when there are health emergencies and disease threats.
When you look at workforce development, it's number 2 on that list. Today, we know that there are several partners on the continent of Africa doing one thing or the other as far as workforce is concerned. What is lacking there is that coordination and collaboration. So Africa CDC will continue to provide a platform that will allow the partners to come together so as to allow for effective and a more efficient utilization of resources, that address the workforce gap on the continent.
During this training, I've learned that you can't say you're working in a reference lab without it being accredited. During these sessions, I've realized that we have gaps that needs to be met, and with this, I'll be able to contribute to the quality for our lab to be accredited.
One of the things that I'm also excited about this partnership is that by building our capabilities, we'll be able to build capacities even in different institutions within Ghana and across West Africa.
We must manufacture our own health products for us to be able to respond efficiently and effectively to any disease threat and health emergency on the continent. These will include the more simple things like masks and gloves, and it will also include the more complex things like therapeutics and vaccines. And this includes also diagnostics that we need to ensure that we know which disease we are dealing with.
Locally, we were producing personal protective equipment, we were producing nose masks, we were producing sanitizers. We were shocked at the level of innovation that Ghanaians had when it came to producing stuff for COVID-19.
The fourth pillar is domestic resources. And this means that we need to go into the new space where our government, our private sector, and members of the public are part of the resources that we are going to be actively using in planning for and responding to any disease threats and health emergencies on the continent. The fifth and last pillar is partnerships. We know that we must do this on our own as Africa, but it doesn't mean that we're going to do it alone. We invite and encourage partnerships.
The way we do partnership also determines the way we act and the way we operate. when we come here as Africa CDC to support the government of Uganda, and we follow the way they drafted the technical documents, plans, procedures, that is what we follow. I think this has given the leverage, like a respectful partnership with the government as well as all other actors in the country that we are closely working with.
Africa CDC's work is a marathon and a relay at the same time. There are those who begin, and then they hand over to those who will come.
Africa CDC has done quite a lot within just 6 years, and I feel like we have the potential to do even more. The past and the current leadership have embedded in all the staff what the institution is looking at achieving, and I think we are all conversant about what we need to do.
Welcome back, welcome back.
Like, honestly, I would attribute it to
We're just about to get into the second session of the morning. I hope the tea break was good and we managed to engage and to network as we move forward with the deliberations. We're moving into the presentation from Mercy on the Africa CDC Epidemic Intelligence Program. She'll take us through a bit more detail into that, and then we will move on to questions following her presentation. Mercy, the floor is yours.
Thank you so much, Victoria. Welcome back, colleagues from Tea Break. Hello. Hi, everyone. Okay, maybe we have the slides up. Thank you. So as earlier presented, I made mention that at the end of this 2-day workshop, we should be able to tell what Africa CDC does, especially around epidemic intelligence and some of the key priority areas that we are keen in supporting. We know the world of epidemic intelligence is so broad, so it's really very important for us to know those areas that Africa CDC is currently looking at strengthening, and you can key into as member states to benefit as well, because that's our mandate, to support you. So the program goal, that's the Epidemic Intelligence Program within the Africa CDC, aims at collecting, analyzing, and interpreting information from all relevant sources to improve early detection and response to acute health risk. So we're really concerned about acute health risk and not just all public health problems. So these are our strategic objectives. We're looking at improving data visualization and analytics, and also reporting of public health risk to guide prompt action. So we have a number of activities that we have been supporting countries with, supporting them in building dashboards, integrating data from different sources, and also improving on their digitalization. We are currently also implementing a program on predictive analytics. And the reason for this is because we've realized that you definitely will not want to be caught unawares. You want to be able to use historic data to be able to inform how your preparedness and also some of the structures and strategies for the country looks like. So as a continental institution, we have this historic data from member states, and we're even looking at improving on the different sources through which we collect this data so that it can be able to inform and guide preparedness for member states. Another very key strategic objective is to strengthen and establish community of practices. For those communities that already exist, we are working with them to strengthen these communities to ensure that countries are able to share data amongst themselves, information that guide preparedness and also cross-border prevention, spread of diseases across borders as well. For regions that don't have, we are looking at operationalizing the community of practices. An example is the Eastern region. We have currently a community, but it's mainly ad hocly done. So it's really not formalized. We have the ECHO where we have different experts that are called in. Some weeks we could have event-based surveillance experts that are brought in to share experiences, but we really want something that speaks to the early warning objective that we are working on. We also providing technical support to member states, and I see a number of us here have interacted with either myself or my team. We are supporting countries to strengthen their early warning systems, and some of which you'll be seeing in the next slides. So basically, these are flagship programs. We have the event-based surveillance program now, which is just a program within the epidemic intelligence initiative. We also have the event management system. We have the integrated disease surveillance. We have data analytics, modeling and forecasting, and we also have a situation room. Some of these programs are already operationalized. Some of those we are making baby steps towards ensuring that they go fully operational. And it's also just a heads up to some of the young experts in the room. We are putting out a number of calls, so look up to our website if you're interested to some of the positions that will be coming up for some of these initiatives that I've presented. So some of the key achievements that we have, as you can see on the right of the screen, it's a framework for Zambia. Zambia, can I see you? Please, a round of applause for Team Zambia. So they did a fantastic job in the finalization or the development of their event-based surveillance guideline. And that was done in collaboration with other partners, Africa CDC, EXA, US CDC, and other, and I think they also received some funding from World Bank. And I mean, it was really a very robust partnership. WHO also supported. So we all came together, joined force, used the Africa CDC framework to develop and finalize the Zambia guideline. And we have done the same for several countries that, that we'll be seeing in the next slides. But again, just to reiterate that not all the countries that are currently implementing the Africa CDC framework has been supported by Africa CDC. Some countries mobilize resources from elsewhere, but use the framework to develop their guidelines. So over 20 member states are currently using our framework to develop their guidelines. We also recently developed the monitoring and evaluation tool, or say framework, which has been incorporated into the revised framework that we'll be launching. So it's kind of annexed. It's an annex within the document that you'll be seeing tomorrow. So this M&E framework that we developed was, we received support from USCDC, I mean, really significant support from USCDC, WHO, and other partners like EXA, SACIT, to get this finalized. And we've been able to help 4 member states to adopt. Of course, we have been piloting and we've seen that it's really, really efficient. Lesson learned on the field has been incorporated. You know, a document is not just developed and it's rolled out. We definitely have to pilot to see the gaps and, you know, get those lessons to better improve before you say it's ready for wider dissemination. And the training manual that you'll be seeing tomorrow has been piloted in 10 AU member states. And you can see the countries that we piloted in Cameroon, Uganda, Zambia, Mozambique, Rwanda, Tanzania, Lesotho, Malawi, Congo, and the Gambia. And we also have developed a scorecard that we that's actually very aligned to the JEE. For us, some of us that have supported the JEE process, we can tell that the JEE is actually a tool that can help you assess capacity. And one of the core capacities within the JEE is on this early warning core capacity. So some of those critical indicators we also pulled to ensure that it's reflected in the scorecard and it's even pieced out so that counties can actually see the progress they are making in the implementation. You can't just wake up tomorrow overnight to say, okay, I have full capacity on event-based surveillance. So counties need to understand what it takes and have to walk through that process. So the technical support, we have supported a number of countries in the establishment of technical working groups, and this is how we have been able to embed the One Health concept in the work we're doing in member states. So this technical working group is made up of experts from the different sectors, the animal, wildlife, the vet, environment, human, and the different sectors that are actually very relevant to early warning. So we have been able to support these 15 member states that benefited to institutionalize these technical working groups. Some countries go as far as getting it endorsed by the ministers of health so that it's actually formalized and they have that mandate to mobilize resources. We have also supported these countries to develop priority lists of signals. For those that are implementing EBS, this would make sense. For those, it might not really make sense, but priority lists of signals are just broad. They are just kind of very broad. They are different from disease, from case definitions, but they are just broad indications that just help you detect anything that could be a public health risk. So it's different from a case definition in that sense. And again, still in the One Health sphere, we've been working with our One Health team. My colleague Wande Alimi, yeah, she has also been very supportive in ensuring that we have the different sectors in the member states integrated within the EBS sphere, so that we are able to detect, countries are able to detect events, not only from the human health, but from different sectors as well. And we have also been able to train more than 2,000 surveillance officers from these different sectors. And this has not been just Africa CDC alone. We have been working with partners like EXA, WHO, SATSIT, and the rest. So coming now to the community of practice, but again, just coming out to the community of practice, I'd mentioned the 3 community of practices that we've established, and these community of practices are actually meeting routinely to share best practices and also share resources. And one of the key things that we are looking at implementing in the next few months is establishing a dashboard of resources on the continent. By resources, I mean experts that can support event-based surveillance, partners that member states can reach out to should they need support, and all that, so that it's kind of seamless. We can be able to support each other to build capacity. Uganda that has gone this far could, deploy a technical expert to another country that is just starting, and vice versa. So that's the vision we have, so that these community of practices don't just, do not just end up as an online platform, but countries can see the value and are able to engage even more. Africa CDC is also proud to be part of the coordination group of the epidemic intelligence from open sources. Yasmin has been very instrumental, and our colleague from WHO, George, we have been working tirelessly to ensure that the countries on the continent as well have the capacity to be able to use the epidemic intelligence from open sources to be able to detect and report public health threats promptly. And this epidemic intelligence from open source is not just a digital tool, but it also has a community and a collaboration initiative within it that can help member states, partners share information and also cross-verify the same. I spoke about our digital solution, and I spoke about how it has been deployed and some countries are currently piloting. But it's worth mentioning that this this solution is supporting Africa CDC's internal processes. And this is how we are able to detect and reach out to member states for the most to be able to respond to the public health threats. I think Dr. Mirawe, who is the head of the APRO division of Africa CDC, will be giving more light on that. So as Africa CDC, we have been able to capture over 300 events, some of which are signals, but permit me use that. We have been able to capture that and been able to process this, come up with products that have really guided Africa CDC's strategic planning and also our support to member states. So we have 4 countries that are currently piloting. I'm happy that Dr. Lekela is here. She's also one of the first countries to have embraced the tool, and they're currently piloting. Dr. Lekela from Lesotho, thank you. So I'm mentioning names so that if you need more information, you can approach these colleagues during free time and get to learn how this has worked for them. Before I leave, how many of us do receive the Africa CDC products? Sorry, my cursor doesn't seem to move, the pointer. How many of us have been receiving these products weekly? If you receive the Africa CDC product weekly, oh, yeah? Okay, so there are quite a number of us that have not been receiving. And you know, those that have received this product can tell you how comprehensive and rich these products are. We have a number of public health threats that we've detected and we're currently reporting, just so that we are all able to prepare and mobilize and channel resources in those critical areas that are very important. And BillNet, you can see this is the product from Zambia. They just started then. I'm sure they are far advanced, so they're using the system to also generate their weekly reports. So this is some sort of our result chain model, and I want to also highlight that it was adapted from a publication or a work that was done by some key experts, some of those who are in the room. I think Arun, they did the work in Vietnam and were able to come up with the first version, which we also picked it up, got lessons also from very robust tools like the 717 from Resolve to Save Lives to be able to come up with our result chain model. So as you can see, where is Dr. Arun? Dr. Arun? Okay, good. So if you really want to learn more about this result chain model as well, I think you can also see her for more insights. So we have the inputs, which are more or less the coordination mechanisms, like the technical working group that we support countries in establishing. We have the guidelines, the training modules. We also need funding, equipment, and staffing. And we also are supporting countries in carrying out these activities like the training, the adaptation workshops, and all those, to finally translate to outputs. And these outputs like improved EBS knowledge, improved multi-sectorial collaboration, sustainable government funding programs, timely reporting of events and other threats. But at the end of the day, what do we want to see? We want to see the impact, which is reduced spillover from the environment or from the animal to the human and vice versa. We also want to see that we have fewer outbreaks. So if an outbreak occurs in a particular spot, we are able to contain at source so that there is no spread. And we also want to see that there is reduced morbidity and mortality. I think this is the most difficult impact indicator to evaluate. But where there is the will, there's also a way. So some of the challenges that we have faced so far is the data sharing, and this is a challenge that even countries know that it's a challenge. So member states even face the same challenge in getting data from the lower levels, but at the continental level, you can imagine the kind of challenge we face. Sometimes we detect it takes time for the countries to verify and get back to us, and also that impedes on the time of the response by Africa CDC. And also the compilation of reports as well. Competing priorities of member states. Sometimes member states are engaged, they want to start building systems, they want to start adopting certain tools. Unfortunately, an outbreak hits. So they are forced to drop that to start looking at putting out the fire before coming back to those system strengthening activities. And that's also a serious issue that we need to look into keenly. Insufficient resource, human resource cannot be overemphasized. We are all struggling with that. Financial resource is also an issue. And we have received so many requests from member states that is actually welcomed. We're really happy that you find us worthy to provide that support, which is really a plus. However, sometimes we are not able to meet the demands of member states. For instance, cascading to all the districts, it might not be feasible as Africa CDC to provide that kind of support. So some of the partners that we've actually done so much work with are those that you see, but we also have other institutions that we are beginning to work with, like the Task Force, Global Fund for Health, and a number of others that we are really looking at. But the member states are at the center, they are the pivot of everything that we do. So I want to end here by saying thank you so much for your attention. I don't want to say see you again, but definitely.
Wonderful, thank you so much, Mercy. She gave some really important numbers in her presentation. 15 member states have established functional EBS units in their respective countries, and over 2,000 surveillance officers trained over the course of 3 years, Mercy, is that correct? Which is fantastic. So it's one thing to actually hear and a completely different thing to see it in action. So I'd like to direct your attention to the screens for a brief video on what's happening on the ground.
Africa CDC in collaboration with Africa CDC in collaboration with African Union provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit, and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet Redis 4 qui est financé par la Banque mondiale, et donc nous allons saisir cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Et notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce qu'au niveau du COUSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya we have county, the subnational level governments, because they also appropriate resources for various activities, so they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers, the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Wonderful to see the action on the ground and what has been done so far. Definitely deserves a round of applause. We're just about to get into the next presentation from Dr. Merawi, who will look at the continental response efforts. Dr. Merawi is the acting head of the Emergency Preparedness and Response Division at the Africa CDC. Can we give him a round of applause as he makes his way up?
Yes, still good morning. Good morning, colleagues. Good morning. Thank you very much, really, for the opportunity to reflect as Emergency Preparedness Response Division, a immediate user department for the epidemic intelligence. So we want to really share you what is, maybe next slide. I just want to share you slide, please. It's this one. Okay, sorry. Okay, maybe to give you some outline, I will give you some background and context, what the Africa CDC mandate and the strategic functions. Merci. And the EPR goals and strategic objectives and epidemic intelligence and EPR and epidemic intelligence and use case scenario that I want to share you how the division is benefiting from, and then critical challenges and the way forward. So just to give you context, you all know this one. I think my colleague from WHO also addressed this morning about the burden of the continent that is regarding public health emergencies. We have really the highest burden in the globe on public health emergencies. We, each year, over 150 public health emergencies are reported across the continent. These are reported. There are so many unreported that we need to be aware of. Of these, 90% are infectious disease outbreaks, and the rest, 5 to 7% are hydrometeorologic events. If you know the continent very well, the southeastern part of the continent is usually suffering with hydrometeorologic events. And when you go up a little more to the Horn of Africa, drought and drought-related health events. And when you go to the west and the Sahel region, conflict, humanitarian, and so on and so on, you go like that. In the Central Africa region, viral hemorrhagic fevers and so on. These are like just events that we usually detect across the continent, and we are struggling all through. And these are most of preventable, controllable diseases that we can really do something about it. And we have a really very promising progress in the last couple of years regarding the response, the speed of response and the response control, the response in the control of the disease outbreaks. And we have progressed very much from over 4 months plus to down to 1.5 months. And this, the last one, if you remember the Uganda, Ebola, Sudan, it was controlled within a record time. We have a very, very good progress, but still the remaining existing challenge. And I will reflect this more later, especially in regard to EI. So the objectives and critical functions of Africa CDC, this is the mandate we are given as the continent by the African Union when they establish, upon their wisdom, they establish the Africa CDC as their own health agency of the continent. They give these strategic objectives and mandates to establish early warning and surveillance platform for active and timely emergency response, support emergency preparedness response, assisting member states in collaboration with WHO and other stakeholders in meeting their international commitments, including IHR 2005 core capacities, and support and conduct regional and country-level hazard mapping and risk assessment, and so on. These are like health emergencies. And recently, very recently, in the, they gave us the mandate for Africa CDC to declare public health emergency of continental concern. So this is really a huge, huge mandate that we are given as a public health agency of the continent. So when you funnel it down to the EPR division, Emergency Preparedness Response Division, our main strategic objectives are like to ensure effective public health emergency preparedness response capabilities across all member states. This is really the overall goal. We want to really get and retire from health emergency engagement. Once member states are capable of doing this business, no one wants to really rush for any disease outbreak here and there from all over the world down to the continent. I mean, we want to really graduate. So that is our ultimate goal. We want to be out of job in the coming years by capacitating member states to have self-resilient and capable of handling all health emergencies within their territories. And objectives are to develop preparedness in its sense with One Health principle, a multi-sectoral approach, multi-hazard, multi-sectoral approach, and also develop that response capacity at national, regional, and continental level. I think these are a lot to be narrated under this Objective 1 and Objective 2, but rather than going in depth, I hope that the organizers will share the slides for you to have a closer look. So I will skip this one, the details of this, and go into epidemic intelligence and EPR. So when it comes to the health emergency division, our as health emergency management team, our role is pretty clearly defined, but it is pretty highly tied with epidemic intelligence. If you don't have intelligence anyway, you can't do anything. So all the epidemic cycle or the emergency, they call it disaster management cycle and so on, but it goes around prevention, mitigation, preparedness, response, and recovery. But all this rotates around epidemic intelligence. The information, the resources that we get from epidemic intelligence, that is pretty much intelligence, to be honest, like the militaries and the national securities. This is intelligence of the microbes that we can't see in our eyes directly. So this all depends, all our activities depend around this activity. And the EI unit that Dr. Yenio Mercy is talking this morning generates a number of products like spot reports whenever they detect anything, and situation reports regularly updating us, and alerts and weekly briefs, maintain database for further analysis and predictive analytics. These are some of the products that we get from the epidemic intelligence unit that we use for emergency prevention, mitigation, preparedness, response, recovery, and rehabilitation process all through. So we are a beneficiary. I want to really emphasize, I'm not emphasizing the benefit, the action or the activities of emergency preparedness response, but I want to shed more light what epidemic intelligence is meant for us and how it has been helpful. And these products, all these products, I mean, epidemic intelligence products facilitate timely and effective EPR actions across all components of health emergency management cycle. Like these products, the spot reps, alerts, all these products we use to investigate health events further, to have a very closer look at it. Whenever they have a signal, they process, they verify, then they send alert to us, or they generate spot reps. Then we go and see it as EPR team, go and see it further, look into the health event and investigate more. And grade events, I think grading and gauging response resources at each level. We can't act all for over 150 health events across the continent. I think that is for an institution like 5 years old, we can't do everything for all these events. So we have to grade them. Grading, I think grading is the process that we use in-depth assessment of EBS reports to determine the level of operational response required, including resources and assets, to respond to public health emergencies at different levels, at national level, at regional coordinating centers, and at Africa CDC HQ level, or we may call it at different levels of activation of EOC and with different levels of force that we deploy for emergency response. So we initiate emergency response based on those products. We also use threat hazard identification mapping and preparedness support based on those reports, and advocate and mobilize resources for prevention and mitigation measures for potential epidemic-prone diseases. I think we all know that the Menafric vaccine has been given across the meningitis belt now. It has been quite some time now. The risk is there. Whenever they detect such meningitis outbreaks across the belt region, that is really a warning that the immunity that we boost some 3, 4, 5 years ago has gone down. That means we need to reinitiate, mobilize more resources, do something on prevention of such epidemic-prone diseases across this high vulnerable region. That is a kind of information that we synthesize out of the products we get from the Epidemic Intelligence Unit. So just to give you some insight about a little bit more, as a showcase, the EI data and reports support response operation decision. As emergency division head, I can't really deploy all resources available at my disposal to support all these outbreaks. So you can see how many member states we have been reporting. And we have graded all events that came from the Epidemic Intelligence Unit. We have different criteria than the criteria they use. We have grading tools that we use. You can see really number of countries affected, not the disease, but the number of countries affected and the number of disease outbreaks across. These all are grade 1. We label them grade 1 and we let it be handled by member states themselves, except when they flag it, like they send us a request, specific request to Africa CDC, we don't jump in, but we monitor. We very closely monitor how things are progressing, worsening or improving, and so on and so on. Sometimes we jump in, like for bacterial meningitis in DRC, we jump in to support the DRC to handle that outbreak. Monkeypox and so on, we jump in to support some of those member states like that. But sometimes we leave it to member states to handle because we don't have all the resources and capabilities. I think that is not because they don't deserve, but because you don't have all the capacities to get engaged in every outbreak. So the others are like grade 2 outbreaks, which are monitored and supported by our regional coordinating centers, our Africa CDC regional coordinate centers at the Eastern, Southern, Central, Western, and Northern Africa region. We leave it there, but sometimes we jump into also support from HQ with a kind of full force to support those outbreaks and response. Our outbreak response supports are very clearly defined what we are going to do, but those resources to be deployed are really gauged based on the capacity, the scope, severity, and the risk of expansion of the outbreak and so on, based on the grades that we give. So grade 2, this is just to showcase, this is just last year. But recently this has also evolved, and we have another grades. Just this is what we have done last year for you to see. So the other showcase is the EI database, the database they have been collecting for the last 5 years. We sit together, we come as EPR, we organize a technical working group and a group of experts, and do a kind of Delphi analysis on epidemic-prone disease prioritization, and that is pretty pathogen prioritization for better preparedness. Had it not been for the database from the EI unit, it would be a very difficult exercise to do so. So we get from we do such kind of prioritization of pathogens. Based on this, we generate another product. I think recently it is you have seen it is published in DVEX and so on. Some of you may have seen that one. It is published on our website, Risk Ranking and Prioritization of Epidemic-Prone Diseases. This product is really very, very important product. One, because this really determines how better prepare ourselves as Africa CDC at a continental level, and all those member states, how they can be better prepared for this priority frequently happening epidemic-prone diseases. So medical countermeasure for 2022-2023 was generated for top 5 priority diseases based on this listing from for stockpiling is under procurement now. And a good sum of investment is done based on such kind of product. And advocate for other partners as a research agenda for the continent. If I go back and show you some of these priority diseases that you can see here, some have the good medical countermeasures like vaccines, diagnostics, therapeutics, PPEs, and so on, but some they may not have at all, and some may have diagnostics, may not have therapeutics or vaccine, and so on. So we are putting this as an advocate tool for partners as a two-set research agenda. Moving forward, we are really moving to look for potential clinical trial materials that can be stockpiled, that can be immediately deployed during this outbreak for some of those vaccines and therapeutics as a clinical trial. So this is another advocacy tool. We work with laboratory division. We share with them. We gave them our priority listing based on the EI database, and based on that exercise, and they are now generating essential diagnostic listing of this. Our priority diseases are also included. Plus, we also approach them to do some more program activities, including like genomic surveillance for some of those priority diseases like cholera and so on, which has never been done before, except now COVID-19 has been one of the critical thing in genomic surveillance, and pathogen genomics has been widely done across the continent the past 2-3 years, 2 years now practically, until actively sequencing. But if you see the number of countries they can sequence other than COVID, diseases other than COVID are very limited. And we are also adding these priority lists to be part of their program. And now the pathogen genomic unit, I think Dr. Yeni can shed more light on this, is now including cholera genomic surveillance moving forward. So this is like a kind of chain of actions, chain of reactions or actions that we are following all through from the database, from EI and so on. And we are now generating trade hazard risk mapping and risk calendar development based on the AI database, as well as other sources. We are generating, we are working on what I call it the Atlas project, which is a 3-year program that we are trying to map out what are the pathogens or the diseases that we need to worry more about. Where are they? And to what extent are they affecting us, and how better can we prepare? That is a project that we are putting in place now. Soon, maybe next year, you will see the Africa CDC Atlas of epidemic-prone diseases, common epidemic-prone diseases. If you come to Africa CDC, you may get that one. And our time is very tight, and by mid of this year, we'll have a first document. Then next year, we'll have, then we'll, by the year 3, we'll have a kind of digital platform where we monitor risk and threat and hazards. So this is like work in progress, but all this is based on the EI database, the EI processes that we are implementing since 2017. So it's not easy. I mean, as a user department, we always wish to get something faster, better, and clearer to move into actions. And we are always challenging them, and we have faced with delays in data and information sharing. These are really critical challenges from EPR point of view. It is really very, very critical, like member states to take seriously, and also to be open and share and be transparent and share this information and data, so that we can collectively act and control the outbreak before it is spill over to other districts or other countries. And the One Health approach is not well integrated in a number of member states, and EI data from that space is not yet very, very clear. But it's not One Health that is challenging, it is the process, the integration and multi-sectoral approach is not yet well institutionalized. That is another challenge. The limited workforce and the community level engagement, these are really very, very important piece. We want to get right information from the communities affected, and we act all together at all levels, from the village to the national level to the regional and continental level. Limited risk awareness and limitation of risk mapping, this is at all levels. To be honest, risk awareness at community level is not yet there. We need to work on that space. And as it goes up, it gets really blurred even to be, this is like a pixel. It gets blurred and blurred when you go up. So we want to really make it very fine-tuned space in that area, but EI data need to be really very robust in that space. Institutionalizing EI, especially EBS, is not yet fast. It is a very slow process, but I can see a very promising progress from 4 member states now, like Mercy presented earlier. And this is good, and this is the way. But, you know, just the way forward is we can't continue lamenting on the challenges and bottlenecks and so on, but let's go into really the way forward. How better can we really do these things? Yes, so one, implementation of international health guidelines and frameworks, including EBS framework, IDSR guidelines across all levels is very, very important that we need to take home as member states. Multi-sectoral engagement with One Health principle and triangulating data from all sectors as epidemic intelligence resources is very important. We need to look into that space as well. And digitizing and decentralizing EI components at all levels. I think the digital penetration across the continent is very promising, and we should enable and use such tools for health system and disease surveillance as a very critical and urgent matter. To be honest, its penetration is very amazing, especially the mobile penetration and so on and so on. And I can give you a lot of delayed reporting and its consequence from my experience being in a health emergency for the last 15 years. But now this is a tool that we can really leverage and get something and faster, quicker, better. So we shall do decentralize and digitize some of those systems. Invest in EI workforce and advocate for community ownership. I think this is also another recommendation that I want to give here. EI workforce is not yet to that level. We need to really invest in that space, and we need to have a very clear feedback loop. Every one who contributed to EI should know what he has done and what he has really contributed, and that will help us to get more engagement of the communities, the EI communities across all levels. So we need to create that feedback loop at all levels. I think these are some of the things that I wish to share you, and if you have any question, comment, reflection, I will be very happy to reflect on. Thank you really very much.
Thank you so much, Dr. Merawi. We're heading into a quick Q&A session or reflections. I think we'll take the next 15 minutes to do that before we go to the next presentation. You do have mics on the tables, so you'll use that to field your questions to any of the past presenters. We can take questions now in the room or reflections. Going once, going twice. That could be a good or bad sign. Yes, ma'am, please, go ahead.
Okay, my name is Moa Lomasomo. I'm from Liberia. So thanks to the presenter for the explained presentation. My concern has to do with the diseases that were listed by country. So what I want to know is that why is it that only few countries under the African Union that were listed with diseases? Is it that the other countries did not submit? Is it a special criteria for that? So if so, what would be the plan to include other countries moving forward? Because a lot of countries are presenting diseases, they got outbreaks, but we saw only a few of the countries listed with the diseases. Thank you.
Thank you very much. Having more countries report on diseases. Any other questions in the room? Okay, let's go to you, sir.
Ok, merci. Je remercie tous ceux qui sont passés. J'ai deux questions à l'endroit de M. Merawi. La première question est sur l'intelligence épidémique et je voulais savoir, pour la gradation des événements, au niveau infra, donc au niveau du pays lui-même, est-ce que la base réagit pour indiquer au pays que l'événement qui est signalé est au grade 1, au grade 2, au grade 3, ou bien il revient en fait à la synthèse globale de CDC de pouvoir situer le pays donc sur sa gradation. Deuxième élément qui n'est pas en fait une question, c'est la recommandation très pertinente d'intégrer la surveillance basée sur les événements, sur la surveillance intégrée des maladies et ripostes. Dans le troisième guide SIMR qui est maintenant utilisé au niveau de l'OMS Afro, la surveillance basée sur les événements a été développée comme une option additionnelle. Et on sait que c'est au regard de la complexité des outils à mettre en place pour rejoindre ou renforcer la surveillance basée sur les indicateurs que nous continuons seulement en fait d'utiliser la surveillance basée sur des indicateurs. Donc un travail à ce niveau permettrait donc à l'ensemble des pays, puisque nous utilisons donc le guide SIMR, à ce que l'EBS soit déjà donc un socle à travers peut-être l'appui du CDC Afrique et autres, pour que dans l'OMS Afro, on puisse être tous en phase, au lieu que ce soit seulement dans quelques pays, à travers donc ces exercices progressifs, que tous les pays puissent entrer donc, dans cet environnement qui, ma foi, est assez objectif pour une détection précoce des événements. Merci beaucoup.
Merci. I think we'll take two more questions. Yes.
Thank you for the presentation. My name is Oyelado Kromade from Nigeria. I would just like to know, for the risk ranking and prioritization tool, is it going to be available at the country level for their risk assessment, just like we do the risk assessment during any outbreak, and to help us guide the level of support to request for, or is it only at the regional level or the Africa level? Then is there any plan to engage countries on capacity building as regards this tool? And I'd like to know how much in alignment is this tool with the STAR tool of WHO, because that is what we're familiar with. Thank you, and over.
Thank you very much. Yes, sir.
Thank you so much for the presentations. My question actually goes to Dr. Mirawi. I think, Dr. Mirawi, you have mentioned something about the pathogen prioritization tool, and this is like capturing a lot of momentum now. So my question is this tool available for, or have you published this tool, or is it available for to be used with other countries or other organizations? And the second question would be, how much of that are we talking about, like two different tools at Africa CDC for the risk assessment, like the prioritization of the pathogens according to the risk ranking of epidemic prone diseases, and how is this linked to the part of risk assessment for event-based surveillance? Thank you.
Thank you very much. I'll call on Dr. Mirawi and Mercy to take up those few questions.
All right, thank you. Thank you very much for these important questions. I love that. So the first, I think, with regard to our grading, is only few countries that are reflected there. There are, the grading is like, there are graded and ungraded. Some are not really graded events. And it all depends on the amount of information data that we got from member states. And we encourage member states to share those information data so that we have a very good visibility of their situation, so that they'll get their appropriate level of grade and appropriate level of support from Africa CDC. There is no any other criteria, and every member state has, and every situation for that matter, every event or emergency has the right to be duly observed and be appropriately graded for our own intervention. So grading is not, I think the second question is about grading is shared to member states. Our current grading tool is the one we use internally for our own response resource prioritization. I mean, so that it's not widely disseminated except for internal capacity, internal teams, so that they know RCC is what they are going to observe, RCC is what they are going to monitor, and so on, and HQ or headquarter colleagues what they are going to supposed to do, and so on and so on. That will dictate our operations and our resources. It's not like for member states to use, but we encourage member states to use the same mechanism so that they can have a team of experts at district level, subnational level, and so on at national level, so that they have all those resources, including workforce, appropriately used without compromising other routine health services. To be honest, this is a very important tool that every member state shall exercise so that resources can be appropriately and properly used. So I think I will leave the EBS issue with Mercy, but with risk ranking, currently we have done this at continental level based on the continental database. And this May, we are going to do it for Eastern Africa region, and it will be done region by region, because it's not always the same disease pattern across the continent. The continent is really huge, and it is at least region by region will give us some regional perspective of what are those priority pathogens that we need to focus on. And then we develop that capacity. We have a strategy to develop capacity for member states to do their own pathogen prioritization and develop a risk calendar. When is cholera coming and what shall I do now? Is that in May, June, or so kind of thing that we want them to do such exercise at national level as well. But now we are moving regionally. This year in May, we'll do for Eastern Africa region based on the Eastern Africa database at HQ, as well as the disease outbreak news with WHO colleagues, all that database at regional economic community health units. We also summarize that all database, then we go into, this is a kind of Delphi exercise from experts. And we have around 19 criteria that will be observed in those prioritization. So we will do that exercise in Eastern Africa, then we move into other regions as well, but member states will develop that capacity and share the document. I think the document is in our website, and you can see the criteria, how we reach out to these, the limitations we have. It's not really ideal and perfect. It is the first of its kind. It is an edition 1. Edition 2 will come every other year, because we summarize it and we revise it and we engage more expertise and expand the level of the expert opinion in that space. So we will revise it regularly. It's not the same list that will come now and then. Every year we'll expand the pathogen. I know you have seen that we have over 150 reported diseases, and we capture only few top priorities. And of these top priorities, we prioritize again to get our limited resources to be optimally used. So that is what we have. Then with regard to the tool is published, Dr. Ahmed, and the risk assessment and EBS risk assessment, we don't really conflict each other. The same, we have some a little bit expanded criteria included within. I think you can have a very closer look all those criteria in the document, so that you can also give. This is the first of its kind, the first exercise in the continent. We want to do it more robust and have very good indicators to capture those important pathogens. And I think there are pathogens with very rare, unobserved, and happening in the remote corner with high potential to be spread across the continent or globally, but they are not really observed because they are not frequently happening and so on, or because they are in a remote and they are really in some corner where they control themselves without much investment and so on. And those pathogens need to also be populated in this list and also get some level of attention. And we are not claiming that this is the ideal document. This is the first of its kind, work in progress. We will have second edition, third edition, and so on. Every now and then we publish this one because it also gauge our responses, it also gauge our resources, it also gauge our research agenda moving forward. Let me stop there. Thank you really very much. Merci, over to you.
Thank you, Dr. Mirawi, and thanks so much, esteemed colleagues, for the questions. They were really very, very vital. Allow me take from the first, the question on why are just few countries listed? Is it that the others are not reporting or they are not actually having outbreaks? As Africa CDC, we have a very systematic way, the way we approach the events that we detect. So when we did, like I mentioned when I was making my presentation, we have over 300 events that we tracked for the past 2 years. And these 300 events, they are not all being responded to. We don't report on all these 300 events. So what are the criteria we use? And again, it differs somehow from what the countries are using, because we are at the continental level. So our, the measurements and the different instruments that we apply towards selecting or picking these events to fit the criteria for reporting it will be somewhat different from how you see that event at a country level. And just to bring us back to what risk assessment entails, you are looking at the hazard, you are looking at the exposure, you're also looking at the context. So sometimes you could have an event that in a country they feel like this is high risk event, but at the continental level we are looking at, do they have effective control measures, treatment in place? If that answer is yes, it already tells you that somewhat the risk is low. But at the country level, you could say, you could have more details around your context to say, hey,
we are not able to reach this area with this treatment. So you might want to do a more granular risk assessment to prioritize certain areas where you need to intervene. But at the continental level, we are looking at it from a more bigger scope, you know. And we're also looking at the ability of that pathogen to cause morbidity and mortality, ability for it to spread, economic consequences. So we are tracking so many events, but at the end of the week, we have, you know, we don't have all those events on our report. We have priority events. And when we send this report to our EPRO team, they go as far as doing a more detailed risk assessment. They do the grading. They get more details from the field, and they're able to come up with facts that will support what decision they are making. So I hope I answered that. Then again, I would not also want to undermine the fact that some countries don't report. Sometimes we detect, and then we reach out to the member states for confirmation, and they don't respond, or they can respond maybe after a while when the outbreak is over, that we had this, and they are able to contain. So sometimes we don't have that information, or we have the information late. Then on the part of the IDSR, event-based surveillance being a part of IDSR, of course we recognize that. And that is why we all as public health experts can attest to the fact that there is no self-sufficient tool in public health. You definitely keep referring to other tools that will support you in better operationalizing certain concepts. I give you an example. The IDSR made mention of media scanning, but WHO still has the EIUS platform, and we also have guidelines to help countries operationalize that. So it is not that it is not part of the IDSR. The IDSR is like a bigger umbrella, but within that you have specific concepts that you might need more details to support countries actually operationalize that stepwise. And we are really working with WHO to ensure that the countries that are operationalizing IDSR, we also move along with the EBS package. Recently, we've developed a kind of a joint force, the joint team for surveillance, and I think EPR also has the same with WHO. And for Africa CDC, we have this with WHO Afro and WHO EMRO. And the idea behind this is to come up with joint implementation plans. And this will help us move some of these packages concurrently. So we are cognizant of that fact, and we are trying to make steps towards ensuring that we move together in the same light. But remember, even the IDSR, you cannot pull experts to the national level and train them for 2 weeks, because IDSR you have to use maybe 5 days or more. And the EBS also has a very detailed package that you need to train them for 5 days for the national team, bringing together the different sectors that are involved. So how do we ensure that we move together but still not you know, interrupt the running of the of the member states? So we are making sure that countries have operational plans. They have strategies for rolling out IDSR, EBS concurrently, so that they have they can see how both the documents complement each other. So I hope I was able to answer to that. Thank you.
Thank you very much. One more round of applause to Dr. Merawi and Mercy for leading that session. In the interest of time, we need to move into the next presentation. We'll be looking at the Africa CDC's experience when it came to using the One Health approach in early warning. Taking us through that will be Dr. Yewande Alimi, who is the coordinator for the Antimicrobial Resistance Program at the Africa CDC. Round of applause for her.
Thank you very much, and good afternoon. It's a pleasure to join you all here. I've always flinched every time I heard One Health, but it's really important that many of our member states, as well as our technical partners, really have highlighted the need for a One Health approach. So I have been asked, IT team, please. Okay, I have been asked to share with you really Africa CDC's work on One Health, and particularly how the One Health approach can be incorporated into epidemic intelligence, particularly the EBS activities. At Africa CDC, we define One Health in a very simplistic yet very encompassing form. One Health is a collaborative, multi-sectorial, and transdisciplinary approach used to attain optimal health outcomes for people, animals, plants, and their shared environment. At Africa CDC, very recently, we sort of revised the approach we use to defining our programs on One Health. Particularly, our aim is really to promote that collaborative multi-sectorial approach to public health issues, recognizing that there is interconnectedness of humans, animals, and environmental health. But most importantly, we aim to strengthen the capacity of our AU member states as well as our regional economic communities to detect, prevent, and respond to disease outbreaks or public health threats at the human, animal, environmental interface. So we have 4 flagship activities. One of them focuses on zoonotic diseases with a published framework that we published in 2020, primarily looking at the activities or the detailed guidance for MPHIs in addressing zoonotic diseases. We also have the African Union Framework on Antimicrobial Resistance, and very recently began our activities on food safety as well as addressing issues on climate change, which the African Union has been championing. So very quickly, I'd like to sort of highlight the relevance of epidemic intelligence into the work that we do on One Health. Like I rightly mentioned, zoonotic diseases is something that is of priority to the African continent. I've had previous speakers really highlight some of the disease outbreaks of zoonotic origin. So we have this framework, which is the focus guidance for MPHIs as well as ministries of health to address priority zoonotic diseases. And where does epidemic intelligence come in? You may have all heard of something called coordinated, integrated, or joint surveillance. Primarily, Africa CDC has some targets, which is One Health coordination, coordinated surveillance, improving diagnostic capacity and laboratory networks for zoonotic diseases, coordinated response as highlighted by Dr. Merawi, and improving the multi-sectorial workforce. So very quickly, why zoonotic diseases? And I'm sure that many of you in your day-to-day work on EBS or epidemic intelligence, you agree with me that Africa has the right biodiversity, the competent vectors, and in fact, our cultural practices such as maybe engagement with wildlife, for example, really helps us propagate some of the emerging diseases as well as endemic zoonotic diseases such as rabies. Of course, the numbers are right there, and clearly highlighting why zoonotic diseases are important. Now bringing it very close. This is just a mapping of the work that our EBS team did from 2019 to 2020. And these are the zoonotic disease outbreaks that occurred on the continent in that particular year. As you can see, rightly said, right biodiversity, right vectors, right environment for propagation of zoonotic diseases. So basically, epidemic intelligence is quite important for one of the things that we are strongly advocating for, and that is joint coordinated surveillance and information sharing systems. Now, the tripartite team, when they were the tripartite, published the tripartite zoonotic disease guide with some key operational tools. One of them is surveillance and information sharing. We argue that EBS, in fact, on the continent, is the most cost-effective mechanism for setting up joint coordinated surveillance systems. It's simple as getting signals or events from animal health surveillance data, public health surveillance data, vector surveillance data, in fact, wildlife surveillance data, like the colleagues in WAR have really been advocating for, but most importantly, the weather and climate surveillance. Bringing it all together, you're able to visualize, create dashboards, analysis, and obviously improve your alert systems, like I will show you in subsequent slides. One of the key examples, and many of the colleagues I'm hoping are present here, from South Africa, Tunisia, Nigeria, and Niger. You will remember 2016 to 2018, when we had the white pelican migratory birds coming in across the continent from southern part of Europe, particularly Russia. On this slide, I'm showing you some of the outbreaks of the highly pathogenic avian influenza, the H5N8 alert. As you can see in the southern Africa, some of the migratory birds, of course, affected the natural, the birds in the natural game reserves, for example, in South Africa as well as Zimbabwe. But bringing it closer to where we are right now, East Africa, you would see some of the domestic poultry, as well as the wildlife beds being affected. So what have we done as Africa CDC? In November 2020, we picked out a global alert coming from southern part of Europe. And immediately we developed a collaborative effort to develop and distribute an outbreak alert, particularly for avian influenza, to our AU member states and regional economic communities. Africa CDC did this together with the EBS team, as well as AU IBA and AU PANVAC. I'm hoping our AU IBA colleagues are in the room today. And this is what we did in November 2020. This was primarily important because immediately our member states started to improve their early warning system, their alert system, looking out for deaths in migratory birds as well as poultry, and creating risk communication materials. I also highlight the importance of using a One Health approach in epidemic intelligence. This was just 2021 to about 2020. You would see that we had a lot of alerts or signals around unknown pathogens in several of our member states. Epidemic intelligence, particularly early warning systems, are really important for us to detect new pathogens that had not been previously detected in sectors. Now you can see that, for example, be it the die-offs in Ethiopia, like the camel die-offs in Ethiopia, or the fish deaths in Tanzania, or the new pathogens detected across the wildlife or migratory beds. All of this brings together the importance for a multi-sectorial coordinated mechanism of information sharing. Now, why is this important? A lot of people have said today, prevention is really better than cure. Across Africa, many of you country representatives will agree that if it's not an endemic disease, it's a new disease. There's several issues that many of our countries are battling with, and we just don't have enough resources. However, we argue that if you invest in early warning systems such as EBS, using a multi-sectorial approach, there is a chance that you can quickly pick up signals or events in your reservoir host, be it wildlife or your domestic animals, and you can potentially prevent a spillover. But even if it does get into your index case in humans, for example, you can also implement quick control measures before it becomes an event of outbreak potential. As much as I've made it seem very easy for you to implement EBS using a One Health approach, there's several challenges that many of our countries will be speaking about, and I'm hoping that we can discuss it in our group sessions and see how we can work together as African countries to improve EBS using a One Health approach. As much as One Health is important, you would agree with me today that there is still limited multi-sectorial collaboration. And there are several factors to this. One is varying capacity across the different sectors. Thinking about the environmental health sector, for example, or the wildlife sectors, who may not necessarily have the capacity that many of you from the human or the agriculture sector have. The lack of data sharing protocols across sectors has always been a challenge, but not just across sectors, also across countries. Thinking about the gaps in information sharing, such as timely dissemination of information and data on parity zoonotic diseases. As much as EBS is that signal that tells us what to do, there is still that need and gap around laboratory infrastructure. For example, how do you verify if you don't have the laboratory capacity within your country? There is also the gap around insufficient human resources, as a robust EBS system requires a multidisciplinary workforce with expertise in human, animal, and environmental health sector. Lastly, I think one critical thing that we are missing is the engagement with communities, as communities would always be our sort of litmus test, your dipstick for knowing what exactly is happening. Think about your farming communities, your market women would be able to ideally tell you what is going on or what is not going right. Of course, with challenges are very clear recommendations. It's impossible for us to really advance epidemic intelligence unless we have that political will and domestic financing. It's important we ensure that we have relevant sector engagement, not just human and animal health sector like many of us know, but there are other sectors like your vector or your wildlife sectors, as well as the environmental health sectors. It's important for us to address issues and ensure that we have strong leadership to advocate for access to information and building the workforce across the continent. It's important and very timely that this EBS framework has been launched, it's going to be launched tomorrow, because this framework will really support and strengthen existing mechanisms for information and data sharing with relevant One Health stakeholders. So I'd like to acknowledge, of course, the One Health EBS teams, the AU IBA and AU PANVAC team for working with me over the past 3 years to achieve and support the work that they do. Thank you very much.
Thank you very much, Dr. Yewande, for that presentation. Moving along, right after this next presentation, we will have a brief session of questions and reflections. But introducing our next presenter, Dr. Tamuno Wari Numbere, who is a medical doctor, an epidemiologist, and currently leads the event-based surveillance team at Africa's CDC Division of Surveillance and Disease Intelligence. He'll be taking us through the CDC's country capacity assessment. The floor is yours, Dr. Wari.
Good afternoon, colleagues. Thank you. So I'll just be giving a summary of the Africa CDC's EBS capacity assessment that was done in 442 member states. We assessed the capacity of 42 member states using the EBS scorecard, which links to the existing MPHI scorecard. Under each function, there's like a high-level indicator that enables the use of the EBS framework to assess the existing capacity of member states. So the respondents were from 42 member states, from five regions, and they comprise of staff from the Ministry of Health and other sectors. However, I will just be presenting on the findings from the Ministry of Health. So we had 29 questions from different thematic areas of EBS, and we sent to the focal points in the member states. As we can recall, Messi also said we had the regional advocacy workshop for some regions. Now, during the workshop, we also gave the questionnaire to the focal points during those workshops. So the findings will be from the assessment of the EBS, what the EBS focal persons submitted, and also during the EBS advocacy workshop. So these are the thematic areas that we looked at with the scorecard. We looked at the surveillance and disease intelligence indicator. We looked at laboratory systems and networks. We looked at the EBS structure. We looked at preparedness and response. We looked at the event management system. We looked at the workforce. We looked at finance, and we looked at legislation. As I continue to present, I just want to also state at this point that this is not like to bring down any of our member states, but just to assess to present on what we have assessed, and then highlight the need on the areas that we need to strengthen and collaborate on. So firstly, starting with the surveillance and disease intelligence indicator, we asked the member states to know who had EBS in place. So from the member states assessed 30, ministries of health and MPHI stated that they had EBS in place. And the various approaches for EBS, which include hotline, media scanning, health facility EBS, community EBS, we also assessed that. So 26 member states stated that they had hotlines, EBS. 21 said they had media scanning. Facility-based EBS was in 22 member states, and community-based EBS was being practiced in 21 member states. And 17 member states indicated that they were working with other sectors. So we, just like Dr. Yewande also just highlighted on the importance of multi-sectoral collaboration, we see that we only had 17 member states with existing collaboration across sectors. We're hoping that this meeting would stimulate those discussions on collaboration and how we can work better across multiple sectors to improve the implementation of EBS in our member states. So 12 member states do not currently have EBS in place, And this has also given us an idea on where to focus on Africa CDC in terms of strengthening the implementation of EBS in member states moving forward. The next question we asked was on the laboratory, the indicator was on laboratory systems. So we asked if the laboratory network had the capacity to test at least 80% of pathogens associated with the priority events. And we had 30 responses. And we can see that only 15 member states reported that they could test at least 80 or more pathogens associated with the priority events for EBS. And this also highlights the need to strengthen laboratory capacity. Another indicator which we looked at was finance. And we looked at the EBS funding mechanisms in countries. We wanted to know who currently funds EBS in the country, and also if the annual work plan or implementation plan for EBS was fully funded for the current year. And we can see that 19 member states reported that they were having partial funding for EBS. And we want to also use this medium to discuss and highlight areas that could be funded for EBS, member states that will need some form of support, and also advocate for more funding and more support from our partners to strengthen EBS in the member states as shown on the screen. Another indicator we looked at is legislation. And as we know, EBS has to do not just with the timely detection, but reporting of the signals to improve early warning and response. So this reporting includes data sharing across multiple sectors. So we had to ask, does the EBS program have a policy in place that authorizes data sharing across multiple sectors to conduct coordinated surveillance? So the member states, as shown, showed that between all the relevant sectors, so health, agriculture, wildlife, environment, they had the legal authority to do this reporting and sharing of data amongst themselves in just 5 member states. And between at least 2 sectors, we had 10 member states, and as you can see, we had none in 15 member states. Again, this is an opportunity for us to discuss on how we can improve data sharing across sectors, and not just within member states, but across borders, as we see that many events are now crossing the borders, as we see in most of our regions, which we're dealing with at the moment. Finally, I'm just going to highlight on workforce. We focused on the national level staff. So how many member states have a trained national team on EBS for all recommended competencies? So if they had capacity to conduct community-based EBS, health facility-based EBS, hotlines, media scanning, the whole spectrum of EBS. And we observed that 17 member states had provided training for their national level staff, and just 7 had competent EBS analysts, EBS officers across the various approaches. Let me conclude by saying that, as you can see, there's a lot of work to be done on EBS, and we hope that this presentation will be a segue into subsequent discussions that we want to have for the next two days, a day and a half, and see how we can come up with concrete solutions to improve and to strengthen EBS on the continent. Thank you.
Thank you so much, Dr. Weri. Very succinct. We're heading into the question and reflection segment. I think we'll dedicate about 20 minutes to this one before we head into lunch. So just as we did before, you can use the mics on the tables. Any questions in the room? Reflections? Yes, ma'am, please go ahead.
Good afternoon. My name is Unje Kaura. I'm the EBS focal person for Namibia. Thank you so much for sharing with us the responses from the countries that we just saw now. My concern is on certain questions because I remember I was very much involved in responding to those questions. For an example, the question on whether whether we have trained national team on EBS, on all EBS recommended competencies. Is something that we responded to because we are not trained in all. We did respond to. And then the other thing is also what I have seen also, but it's not indicated as such. The other aspect that I've seen also is the question on whether the EBS annual plan has been fully funded or not. Now, the moment that you do not have trained people, you don't plan for that. So I don't know, maybe it's something that I want to alert the House and also the presenters so that maybe, because sometimes the question does not make provision for you maybe to put the right responses. Thank you so much.
Thank you very much. Yes, go ahead.
Thank you for the highlight as well, looking at the different country capacity perspective. So my question also is on the aspect of fully funded or not. My name is Oyelado Okoromade, once again from Nigeria. I think it would be good to know in what category, if we're talking of fully funded and partial or no funds available, is it strictly from the partner support or from the government perspective? Especially if we're talking of sustainability, we can't be over-reliant, 100% fully funded on partner support. So it would be good to have that category also well spelled out. Thank you, and over.
Thank you very much. Any other questions, reflections? Yes, sir, go ahead.
All right, sorry, good afternoon, everyone. My name is Emmanuel Loki. I'm from Nigeria. I just wanted to ask for the One Health. Yes, from the presentation, which is very good, a very brilliant one, they were highlighted a bit of data gaps. And, you know, for some time now, some of the other sectors are existing, and they should have a platform where they capture their structured data. And of course, for the health sector, so we have the data and platforms where we capture EBS data and other related health data. So I was just thinking, what kind of coordination mechanism for data would you want to set in place, you know, where all these structures are currently existing? And also looking at what is available, these platforms, some of the health systems have their EMS structures and data platforms. Do you want to look at expanding those EMS platforms to other sectors to have one coordinated sector, or do you just want to have this data all around different platforms for One Health? Thank you. Emmanuel Loki is my name, from Nigeria. I work with Japaigo.
Thank you very much. We'll take another round of questions. Yes, please go ahead.
Good afternoon, everyone. My name is Victor Tebit, Partnership for International Education and Development. I'm very interested in the question of data. Everything that we do is based on data. And we can see that there's a challenge here with some countries not even being able to provide data when it's needed. And again, the quality of data from the countries that we get that data may be a problem too. So my question is CDC, or what is CDC doing, perhaps at the level of AU, to make sure that there's something like charter that will mandate release of data, which will help in every intervention that they do, so that, you know, now that we're a global village, a country cannot withhold its data and put the rest of the people at risk. So what's the CDC doing to make sure that it's incorporated in the AU charter, that that data should come out when it's requested, and that even countries themselves should be able to share data amongst themselves? It was appalling to realize that there were 5 countries that, you know, data was not being shared within their organs. So it's very worrying. So I just wanted to point that out, because it said garbage in, garbage out. So if we don't have proper data, we cannot have any analytics that makes sense. Thank you.
Thank you very much. We'll take one more round of questions. Yes, please, go ahead.
Oui, je suis le docteur Etoun Dimbala, je suis le directeur de la lutte contre la maladie, les épidémies et les pandémies au ministère de la Santé publique. Bon, ça fait 10 ans que je suis là. Hein. Bon, pourquoi j'ai dit 10 ans? C'est parce que pour vous dire que j'ai vu naître Africa CDC, et c'est avec beaucoup de plaisir effectivement que je vois que Merawi et les autres sont devenus des grands et qui s'approprient ce projet que nous avons vu naître. Je voudrais juste souligner 2 petites choses, peut-être que j'aurai l'occasion d'en dire quelques autres. Je crois que sur le plan technique, scientifique, les documents que nous allons élaborer, les outils que nous élaborons, ils sont merveilleux, ils sont bons. Je pense qu'il n'y a pas souvent grand-chose à dire. Et pour vous tous qui êtes experts dans la salle, je crois que vous avez le temps de revoir ça. Mais je crois qu'il y a des choses sur lesquelles nous allons buter et qu'il va falloir qu'on rappelle tout le temps. Et moi, je peux vous le rappeler puisque je vous dis que je suis là depuis 10 ans. Donc, la première chose, c'est que nous oublions souvent que, par exemple, pour la surveillance est une seule. Il n'y a pas une surveillance basée sur les événements ailleurs, il n'y a pas une surveillance animale ailleurs, il n'y a pas ceci. La surveillance est une. Ça nous oblige à mettre des outils en place, à faire tout pour que ce soit une. Aujourd'hui, par exemple, on a tendance à parler de la CIMR d'un côté, l'EBS d'un côté. Non, c'est la même surveillance. Et je crois qu'au Cameroun, en 2021, notre document de CIMR intègre désormais la CIMR et tout ce qui est EBS. La surveillance est une, et nous avons décidé que ce n'est pas le DHIS2. Ça doit être comme ça. À partir du moment où ce n'est pas le DHIS2 que nous avons accepté, tout le monde doit aller là-dedans. Et donc, il n'y a pas à dire que c'est ça, on doit aller dedans. Après, maintenant, sur Africa CDC. Africa CDC, vous oubliez parfois que vous n'êtes pas l'OMS ou les autres. Vous êtes les États. C'est-à-dire que parfois on a tendance à agir à partir d'Addis Abeba et d'organiser tout ce qu'on veut. Mais vous devez savoir que votre force ne vient pas la force des États, des ministères de la Santé publique. Vous êtes les États. Donc, à partir du moment où vous allez prendre ça en considération, les États n'ont pas d'autre choix que d'obéir aux règles de l'Union africaine, d'avoir un système fiable de recueil des données, des informations qui fait que ça peut remonter à votre niveau. Peut-être que vous comprenez bien ce que je dis. Vous avez le pouvoir, n'allez pas mener des batailles que vous avez déjà gagnées. Donc, vous devez vous asseoir sur ce qui existe déjà, sur tous les documents qui existent, vous devez mais surtout utiliser le pouvoir que l'Union africaine vous a donné afin de mettre dans des pays des systèmes de détection précoce qui vont d'abord protéger ces pays et protéger les autres pays et protéger le continent. C'est pour cela que je pense qu'il y a eu un gros débat la dernière fois d'introduire la notion d'urgence continentale. Merawi, on vous a donné le pouvoir avec cette affaire-là. Urgence continentale. On vous a donné ce pouvoir, prenez-le. Peut-être que j'interviendrai plus tard sur d'autres choses, on pourra discuter. Mais c'est pour dire que essayez d'harmoniser ce qui se place, essayez de vous approprier le pouvoir qu'on vous a donné, essayez aussi dans votre mise en œuvre que les divers secteurs s'approprient la surveillance basée sur les événements. C'est le problème de la communauté. Ce n'est pas nous qui allons avec les équipes pour aller faire ça là-bas. Tant que nous n'aurons pas compris que c'est leur affaire au niveau de la communauté et qu'eux, ils doivent seulement remonter et que vraiment, on n'aura rien compris. Donc ça aussi, c'est des petites choses que je voulais relever dans la mise en œuvre. Merci.
Thank you very much. We'll take one or two more questions as we wrap up this question cycle. Yes, please go ahead.
Thank you very much. It is a general reflection. I am Dr. Soua Bougatef from Tunisia. I am head of epidemic intelligence. So during the last years, we developed a preparedness and resilience plan. But during the pandemic, we realized that we are sufficiently prepared because we have a lack of strong early warning and response system. We don't have enough staff trained in contact tracing, in IPC, and we all manage the lack of vaccine doses in the continent. So we need to learn lessons after this pandemic, with inter-action review and after-action review, because before the memory phases, you know that our memory is very short. So I ask if Africa CDC collaborate with member states to put some inter-action and after-action review and to learn lessons, and that will serve to update the preparedness and response plan. Thank you.
Thank you very much. Going once, going twice for the last question of the session. Fantastic. Oh, yes. And then we'll come to the two in the corner. I can see you. Go ahead.
Thank you so much for the presentation. I think my question goes to Dr. Wari. Based on the assessment that you have made with the 41 countries in Africa, what are the recommendations that you came up with for Africa CDC and for the partners if they want to support the EBS implementation in the continent? So what could be your summary for your findings? Thank you.
Thank you. The two gentlemen in the corner of the room. Yes, go ahead.
Ok, bonjour, c'est Dr Sendou, directeur général de la santé, Union des Comores. Je voudrais intervenir par rapport à beaucoup de choses qui ont été dites. On nous a parlé lors de la première présentation d'un guide qui est déjà disponible. Et moi, à ma connaissance, je ne suis pas au courant de ce guide, alors que le seul guide que je connais, c'est le guide ECMR, Surveillance intégrée des maladies et ripostes, élaboré par OMS Afro. Et je voudrais savoir quelle est l'interaction ou bien la valeur ajoutée entre le guide que vous avez élaboré et le guide ECMR que nous avons l'habitude d'utiliser jusqu'à présent. Et je voudrais également indiquer que, comme on l'a rappelé tout à l'heure, que la plupart des pays ont essayé d'élaborer, de faire la mise à jour de la troisième édition du guide ECMR. Et, sauf oubli de ma part, la surveillance basée sur les événements se trouve là-dedans. Bien que la plupart des pays utilisent la surveillance basée sur les indicateurs, mais la surveillance basée sur les événements se trouve dans ce guide. Moi, en ce qui concerne l'Union des Comores, je voudrais savoir comment le CDC Afrique pourra nous appuyer pour mettre en œuvre la surveillance basée sur les événements. Ça a été rappelé tout à l'heure également que, comme vous le savez, la surveillance épidémiologique, la surveillance de façon générale, c'est un processus systématique et continu. Je ne pense pas que, en voulant trop faire, on risque de ne rien faire, parce que si tout est prioritaire, alors rien n'est prioritaire. Nous sommes en train de parler de la surveillance basée sur les événements, nous utilisons la surveillance basée sur les indicateurs, etc., etc. Mais comme ça a été rappelé tout à l'heure, nous avons une seule surveillance épidémiologique dans tous les pays. Et comment vraiment essayer de coordonner cela afin que nous puissions vraiment aboutir aux résultats escomptés. Et parlant de la surveillance également, c'est que dans nos pays, nous avons eu à former, avec l'aide de l'OMS, les équipes d'intervention rapide qu'on appelle les EIR. Et vous n'êtes pas sans savoir que quand on parle de la surveillance basée sur les événements, moi, par exemple, dans mon pays, nous utilisons ce qu'on appelle les points focaux. Ces points focaux sont les relais communautaires, les agents de santé communautaires, qui ont montré leurs preuves lors de la gestion, lors de la riposte à la COVID-19, parce que c'est eux qui ont remonté les informations, qui ont été validées et qui nous ont permis quand même de riposter efficacement jusqu'à pouvoir endiguer la pandémie jusqu'à ce jour. Donc moi, je voudrais vraiment comprendre effectivement comment pouvoir coordonner tout cela afin de pouvoir vraiment arriver là où on veut aller. Et comme vous le savez, dans nos pays, en tout cas dans mon pays, nous avons des problèmes au niveau des ressources humaines. Je sais que CDC Afrique ne va pas recruter à la fonction publique. Mais nous, ce que nous faisons, bon, je ne trouve pas que ça, c'est quand même sécurisé parce que les différents partenaires qui nous appuient, ils nous appuient pour pouvoir vraiment mobiliser les agents qui ont tellement servi dans nos systèmes de façon bénévole. En quoi faisant? En contractant avec eux pour 1 an, 2 ans. Je trouve que ce n'est pas vraiment sécurisé, mais que peut faire vraiment Afrique CDC afin de nous aider à lutter contre le problème des ressources humaines, pas pour recruter à la fonction publique, je l'ai dit tantôt, mais comment pouvoir vraiment essayer de contractualiser, fidéliser nos agents qui travaillent dans le bénévolat, parce que ce sont les agents qui existent sur le terrain et qui remontent les données, mais à la moindre occasion, ces agents disparaissent parce qu'ils ne peuvent pas travailler bénévolement durant leur vie. Et comme pour terminer, vous avez parlé de la RAM, la résistance aux antimicrobiens. C'est un sujet vraiment qui est d'actualité et nous, dans notre pays, nous sommes avec l'aide de l'OMS, nous avons déjà élaboré notre plan. Et moi, je suis vraiment agréablement surpris de constater que CDC Afrique appuie à la mise en œuvre de la RAM. Mais le problème que nous avons avec CDC Afrique, moi en tant que DGS, directeur général de la santé, je voudrais ici, au sortir de cet atelier, connaître les personnes avec lesquelles je peux collaborer afin de pouvoir avoir les aides, les appuis techniques et financiers, afin de pouvoir faire la mise en œuvre de tout ça. Tout en sachant que, avec tout ce que nous sommes en train de dire, ça relève toujours des urgences. Moi, par exemple, dans mon pays, nous n'avons pas encore pu mettre en place un centre des opérations d'urgence et de santé publique. C'est un problème qui nous préoccupe, alors que, comme vous le savez, notre voisin, la Tanzanie, est en train de lutter contre la fièvre de Marburg. Et nous avons des systèmes vraiment de surveillance qui ne sont pas résilients. Nous avons des problèmes de mitigation. Comment faire pour pouvoir, ensemble avec CDC Afrique, avec le pouvoir qu'on vous a donné, l'Union africaine vous a donné un pouvoir vraiment exceptionnel, comment pouvoir aider ces pays à pouvoir vraiment indiquer ces différentes épidémies. Et pour terminer, enfin, c'est par rapport au DHIS2. Nous sommes en train d'implémenter le DHIS2 au niveau de la direction de l'information et des statistiques sanitaires. Mais malheureusement, je constate qu'on assiste à des missions exploratoires. Ça fait déjà plus de 2 ans. On n'a pas pu vraiment, de façon concrète, mettre en place le DHIS2. Alors qu'on sait que c'est le seul outil que nos pays est en train d'utiliser afin de pouvoir vraiment compiler, analyser et pourquoi pas donner des tendances qui seront vraiment fiables pour vraiment avoir des données fiables. Parce que sans données, on ne pourra pas riposter. Merci beaucoup.
Thank you very much. I believe in the interest of time, we have to get to the responses. So I'd like to call on Dr. Yawande and Dr. Wari to respond to their questions.
Thank you very much for those very insightful questions. I will try to do my best because there was quite a number of them. Addressing the questions around where data should be hosted, if it should be separate. Again, when you understand that particularly how we have tried to describe it is in the EBS context. Our teams, when they go onto the field and when they go to countries to support countries, one of the critical things that we always advocate for is that multi-sectorial coordination mechanism. And one of the things that the teams usually do would be to set up EBS technical working groups, pulling from all sectors, pulling relevant experts from all sectors to ensure that the data feeds right into the national sort of coordination mechanism. This is quite important because without a multi-sectorial coordination mechanism at national level, you would still continue to have pockets of data. So it's really important that we bring all the relevant stakeholders together to ensure that information and data is timely shared as required. At a more continental level, one of the things that we are doing as the Africa Union, not just as Africa CDC, but looking at AU IBA, for example, is we realize that there is disparity when it comes to the quality of data. Thinking about information collection standards, the protocol required. So AU IBA has been leading a continental advocacy, and this is funded by GIZ. It's called the One Health Data Alliance. And one of the things that we're doing is really defining what the minimum requirement should look like when collecting relevant information, thinking about shared public health threats across all sectors. I think beyond that, there's also opportunity for you to really host your EMS within your multi-sectorial coordinating mechanism. I am quite aware that quite a number of countries already have a One Health multi-sectorial coordination mechanism, and EBS or epidemic intelligence can really fit into that mechanism. At the level of the Africa CDC, of course, I'm sure that you saw the presentation from Messi, where she highlighted the Health Information Exchange document, policy document. Primarily, we've developed that document to really define what the standard should be for good quality data. Rightly said, without good quality data, I think it's just a waste of effort. So it's really important that we get good quality data coming out from all the relevant sectors. Colleagues have highlighted something that is quite critical and is really part of what we are championing as Africa CDC in the new public health order, workforce. As much as we think, as much as we appreciate global financing, global contributions, it's really important for us to look inwards as countries. It's important for you to be able to advocate for that political will. What political will means is your countries will be able to prioritize. Then you can have domestic financing. I think many of us would agree that several of our technical programs, be it your EBS, be it your AMR, be it your TB programs, have been financed by technical partners. But until we as AU member states start to look inward, really think about things like the Abuja Declaration on Political Financing for Health, then that's when we are able to invest in our workforce. We're able to ensure that we have the right cadre of a workforce required for us to address several of the shared public health threats. Moving very quickly to AMR, I think colleague, I would be the right person to speak with, or otherwise, Dr. Yenyu, you can also speak to Dr. Yenyu when it comes to antimicrobial resistance. But primarily at the level of the Africa Union, what we have done, and I like the statement from Messi where she says, in global health, there's no really one way to fix it. Means that you have to reference or acknowledge other operational tools, frameworks, or strategies. One of the things that we have prioritized at the level of the Africa Union is really to use our political mandate to get that vested interest on antimicrobial resistance. So it's not to duplicate. As a matter of fact, one of the things that we encourage countries to do is to develop their NAP, that's your National Action Plan on AMR 1.0. For countries that have not developed this, I think one of the things that we have been doing with our colleagues at the regional quadripartite level is really to ensure that countries are now using granular data to revise their NAPs to ensure that this is really evidence-driven. So really, at the level of the African Union, one of the things we are championing is the implementation and development of this strategic document, operational tools available to help you improve your health systems and primarily to address antimicrobial resistance using a 1.0 approach. I will be available maybe at tea, coffee, for you to chat with me if you want to talk AMR. Thank you.
Thank you, Wendy. Maybe we'll let Dr. Yenyu reflect on some of those concerns because they really need to be addressed at higher level. Dr. Yenyu.
Yeah, thank you. Thank you very much. So I would like to really acknowledge those critical comments and recommendations that came from member states, Cameroon, Comoros. So those are important. I would like to reflect on when we single out event-based surveillance, so we are not saying, that is the only surveillance strategy that we are pushing. We know, IDSR it's a very old program and it's heavily invested and many countries are using it. So we as Africa CDC, we also promote, the use of IDSR as a surveillance strategy. However, we singled out EBS because we saw that the implementation of EBS as part of IDSR is very weak in Africa. And if we see, the IDSR and indicator-based surveillance, until you collate the report and try to make, the sense and the trend out of it at Ministry of Health level, so it will be a little bit delayed in terms of identifying, your outbreaks immediately. So that's why we have been emphasizing, EBS as part of IDSR. So we are not really, inventing the wheel. So we are really, trying to work under, the global guidance coordinated by WHO, but we are trying to complement, taking that, EBS has not been implemented very well. And you found, for example, from the assessment that that's not the case. So many countries don't have the means to really, implement EBS. And the technology is also advancing. So epidemic intelligence from open source has not been really exercised very well. So we are trying to emphasize also, scanning media, social media, and any key informants from the community and so on. For us, to immediately detect the outbreak. Otherwise, we are not really contradicting with any WHO guidance, or we are not even duplicating, what WHO is doing. We are trying to be complementary. So, in line with the data completeness, which was also, asked here, I think it's very important. So we have some challenge in terms of getting, complete data from member states. We know our role as a continental public health agency, and we have been given that mandate. But reinforcement of data collection from countries, it requires a consensus. It requires also a mutual understanding what we are making out of that data coming at Africa CDC level. So we want also to demonstrate how important it is compiling data at continental level, making meaning out of it, and make it ready for action. So I think we are the organization of member states, so many member states trust on us. I think we will continue working with them to make sure that we get complete data from member states. And there has been a significant improvement in the last couple of years, especially our contribution for the continent during COVID response has been very significant. So we have really won a trust from member states. So I think we will work with you to really make the data that's coming to us a complete one. And of course, we depend on countries to support us so that we operate as we are expected by member states. So the other one is in terms of some of our guidances, our recommendations. So we try to work with all important public health agencies like US CDC, European CDC, WHO, so that we are not really contradicting. We make sure that what we say is in line with international recommendation, but we do also prioritization for Africa. Because global guidance usually may not fit into the continental context because we have a different setup, challenges are different. So I think we try to really contextualize international recommendations based on the African context. So which means that if we do something on IDSR, so we are not contradicting WHO, but we try to make it fit for purpose for Africa based on our local context. So on health, on the workforce for health, as our colleague from Comoros said, we don't hire workforce for member states, but our role will be elevating their competency, and then we will have our response team in case emergency deployments required. Otherwise, for day-to-day purpose, running a program at Ministry of Health, so we will not be hiring the human resource, but we really advocate at continental level to have enough resources in terms of epidemiologists, lab technicians, health informaticians, and so on. Thank you. I just wanted to reflect on those things.
Thank you very much. And we are just about 2 minutes behind schedule, no problem at all. So we're about to go for lunch. Is Winnie in the room just to give us a reminder of where that will happen? I believe vouchers will also be handed out to delegates just as you are leaving to head over for lunch. We have a good hour for that. So hopefully we can be back here by 2 p.m. for the afternoon sessions. We have an exciting panel discussion that will be moderated by Dr. Victor Tebit. And of course, we'll be going on with other activities later on. So for now, we can release for lunch. Winnie, do you have a word? Okay.
Hello, everyone. So as we break out for lunch, I believe everyone has received their voucher. We are having our lunch at the same place where we had breakfast, the Ladder. Okay, we'll get you some. The restaurant called Ladder, the same place where we had breakfast. For our brothers who are within the Ramadan season, we've given you vouchers, but you can hold on to them until evening, when you can have your meal. Thank you.
Thank you. You are free to leave, and we'll convene back here at 2 p.m. Thank you so much.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne la surveillance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa's CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa's CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and our country tried to adopt manual to domesticate it to our purpose for the event-based surveillance.
And we've also aligned our attention on the framework that was developed by African CDC. We've benefited from a lot of support.
Worthy of note, this framework has set Africa CDC in setting up a functional epidemiology unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African member states on event surveillance the last 5 years.
C'est financé par la Banque mondiale et donc nous avons saisi l'opportunité de former les cadres nationaux, c'est-à-dire de formation en cascade sur la surveillance basée sur l'événement. Et notre défi, c'est très difficile. D'ailleurs, nous sommes
not trained, not developed from the base surveillance. We instituted a community event-based surveillance to be able to detect and report suspects on time. And this has clearly helped in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis, and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce qu'au niveau du COUSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So we find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya we have county, the subnational level governments, because they also appropriate resources for various activities, so they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Lukwara, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adoption of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet REDIS 4 qui est financé par la Banque mondiale, et donc nous avons saisi cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Mais notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all seems a lot of funds. And as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers. the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département La Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne la surveillance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le PDIS 4 à la Banque mondiale, et donc nous avons saisi cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Un autre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait que nous mobilisions les équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds. And as such, it's not something that you can just roll out in the entire country at a go. So we find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya we have county, the subnational level governments, because they also appropriate resources for various activities, so they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers on the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threat on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adoption of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow, with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet Redis 4 qui est financé par la Banque mondiale, et donc nous allons saisir cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Et notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COUSPE, on avait un centre d'appel. Donc, ça partit des alertes que la communauté nous envoyait, et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers, because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers, the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne la surveillance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
Check 1 and 2, 1 and 2. Check.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People,
Check.
Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this,
Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet REDIS 4 qui est financé par la Banque mondiale, et donc nous avons saisi cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Et notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has really helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait que nous mobilisions les équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds.
Check 1 2. Check 1 2. 1 2 1 2 1 2. Check 1 2.
So we find ourselves doing
Check 1
bits and
2.
pieces. So it means in certain areas, largely we've not done much. So that still remains.
Check 1 2 1 2 1 2.
Disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers on the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer le cadre dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked.
Tutoe hiyo, check. Iko. Hebu kwa both kama iko. Check. Ndio hiyo. Iko sawa. Okay, hebu enda kwa booth.
Check 1 2 1 2 1 2. Check 1 2. Check 1 2 1 2 1 2 1 2 1 2. Check 1 2. Check 1 2. Check 1 2. Check 1 2 1 2 1 2. Check 1 2 1 2 1.
Iko aje hapo? Inakuja? Okay. Kwa hii ingine. Okay, unanipata? Okay. Sawa. Okay. Kama unaniget ni sawa.
Africa CDC went fully operational. One of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
le projet REDIS 4 qui est financé par la Banque mondiale. Et donc, nous allons saisir cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Et un autre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait que nous mobilisions les équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers on the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne l'assurance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adaptation of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet REDIS 4 qui est financé par la Banque mondiale, et donc nous avons saisi cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Mais notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
la surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel. Donc, c'est à partir des alertes que la communauté nous envoyait que nous mobilisions les équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds, and as such, it's not something that you can just roll out in the entire country at a go. So we find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya, we have county, the subnational level governments, because they also appropriate resources for various activities. So they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers, the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likwala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne la surveillance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adoption of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers from 27 African Union member states trained on event-based surveillance in the last 5 years.
Le projet REDIS 4 qui est financé par la Banque mondiale, et donc nous avons saisi cette opportunité pour former les cadres nationaux, c'est-à-dire faire des formations en cascade sur la surveillance basée sur les événements. Mais notre défi, c'est l'accessibilité très difficile de certaines zones.
Based on our training and the knowledge that we got from the event-based surveillance, we instituted a community event-based surveillance to be able to detect and report suspected cases on time. And this has greatly helped us in the timely detection and reporting of suspected cases of acute kidney injury in the country.
Our strategy as Africa CDC involves supporting member states in establishing functional multi-sectorial event-based surveillance technical working groups, riding on existing One Health coordination mechanisms.
We've seen prompt detection of diseases, both in animal and human. Diseases such as foot and mouth diseases, severe acute respiratory illnesses in the country being detected through the system in a timely manner. We've had improved detection rates of acute flaccid paralysis to the extent that regions where we've implemented this surveillance system, we've had them turn from red to green. Animal diseases are now being detected by both community health volunteers in the Ministry of Health.
Developing digital solutions to support the capture, analysis and reporting of event-based surveillance data.
La surveillance basée sur les événements nous a beaucoup aidé dans la remontée des données de la communauté au niveau du centre d'appel, parce que au niveau du COSPE, on avait un centre d'appel, donc c'est à partir des alertes que la communauté nous envoyait et nous mobilisions des équipes d'intervention rapide pour aller faire des investigations.
One of the challenges we faced was the capacity gap of surveillance officers and community volunteers because we've not trained them on the EBS concept. The training was only limited at the central level, at the district and regional level. There was no training.
To train all the stakeholders involved consumes a lot of funds. And as such, it's not something that you can just roll out in the entire country at a go. So you find ourselves doing bits and pieces. So it means in certain areas, largely we've not done much. So that still remains a problem.
The other thing is limited material resources for the implementation of EBS in the country.
Nous avons toujours pas de moyens disponibles, des moyens à notre disposition pour pouvoir implémenter la surveillance basée sur les événements dans notre pays.
I think moving forward, we will need to invest a lot in advocacy so that we get buy-in from not just the national level government, but like in Kenya we have county, the subnational level governments, because they also appropriate resources for various activities, so they need to put in some resources in this program.
My recommendations will be first, Africa CDC and other partners to support in the step-down training of surveillance officers and community volunteers on the event-based surveillance. That will be first one of my recommendations.
Et des autres partenaires, nous allons relever très vite ces défis parce qu'au cours de cette année, nous avons fait un programme déjà pour commencer les formations en cascade dans toute cette zone, non seulement de la région, du département de la Likoala, mais aussi dans les autres départements du pays.
We appreciate the support so far that we get with this. It's our dream that we cover the entire country with this surveillance system. It's our dream that we cover the entire continent with this surveillance system. It's our dream that we get linked with similar surveillance activities that are happening across the continent.
Most importantly, establishing regional community of practices to facilitate the sharing of information and best practices within the regions. Africa CDC, in collaboration with partners and other regional actors, will continue to advance this agenda and also widen its reach until every member state is capacitated to detect and respond promptly to all public health threats with minimal interference in trade and travel.
I appreciate the support that we've gotten from our leaders, right from the departmental head, the ministry, the national, and even the regional supporting surveillance systems.
Africa CDC, in collaboration with African Union, provided the technical and financial support to establish EBS in the Gambia.
Africa CDC nous a apporté tout l'appui logistique et technique déjà pour finaliser et valider les lignes directrices en ce qui concerne la surveillance basée.
In Kenya, we were able to revise our technical guidelines for the routine surveillance system to include the event-based surveillance system.
Sur les événements, nous avons à l'occasion défini les principaux signaux.
Of course, there were numerous achievements during the process or in the establishment of EBS in the Gambia.
In 2017, when Africa CDC went fully operational, one of the critical areas identified was the need to strengthen early detection and response to public health threats on the continent. Initiatives like the African Passport and Free Movement of People, Open Sky Initiative, and the Free Trade Agreement that is currently being onboarded further highlights the importance and urgency to establish early warning and response system for the continent. As a way of achieving this, Africa CDC developed the first ever edition of an event-based surveillance framework in 2018 to guide Africa CDC and member states in the operationalization of event-based surveillance.
The trigger of all this was the declaration of revised international health regulations of 2005 that prompted member states to put in place early warning systems, and one of these early warning systems involves event-based surveillance.
Je dirais qu'avec l'appui d'Africa CDC, nous avons donc commencé à amorcer le processus de mise en œuvre de la surveillance basée sur les événements dans notre pays.
Africa CDC supported and facilitated the adoption of the event-based surveillance training manual. This was very helpful, and as a country, we tried to adopt that manual to domesticate it to suit our purpose for the event-based surveillance.
And we've also aligned our implementation on the framework that was developed by African CDC. We've benefited from a lot of technical support.
Worthy of note, this framework has supported Africa CDC in setting up a functional epidemic intelligence unit and guided over 20 member states in the implementation of early warning systems. Our reach continues to grow with over 1,800 surveillance officers.
Good afternoon, everyone. Welcome back. I hope lunch was good. We sound energized, which is great. I hope we also got to network. There was a challenge. Dr. Victor actually came up to me earlier. He said, "I'm here to make friends." So he handed his business card. And I'm challenging everyone in this room to leave with at least 3 business cards of someone you have not met. I know this is a network that you all know, pretty much everyone, but try to make an effort to branch out of your comfort zone. Great, so we're gonna get into the second session of the program. We have about 3 presentations and a panel discussion coming up. And before we get into that, we want to play a short video just to set the stage, set the tone for what's coming up in the presentations and, of course, the panel discussions. So tech team, I believe we have that queued up. All right, I want to direct your attention to the screen now. Thank you.
In 2001, Zambia was part of the participants that were in Gaborone to learn more about artificial intelligence use in public health. But one of the outputs was that of forming the community of practice for EBS for Southern Africa.
Working with African CDC has actually enhanced our understanding of importance of event-based surveillance at national and international level.
The event-based surveillance framework of Africa CDC has been to operations for the past 4 years, and there are a couple of things that have taken different changes. And to reflect this into context of the current situations, we also provided technical support in the revision of or updating the event-based surveillance framework of the Africa CDC.
Donc, depuis 2016, la Tunisie est en collaboration avec la GIZ. Nous avons commencé à mettre en place la surveillance basée sur les événements, dont l'objectif est de détecter les événements de santé, de pouvoir les évaluer.
In 2022, Africa CDC established the Event-Based Surveillance Committee of Practice as one of the strategies to improve collaboration between member states in the region towards strengthening early warning and response.
Looking at the domain is obviously event-based surveillance, but in terms of the advantages of being part of the community of practice is that we've shared information as relates to guidelines, policies, the issues around sharing surveillance information in terms of sharing weekly bulletins across the country. So we've had also support from the Regional Collaboration Center through the Surveillance Department in terms of sharing the updates which they are picking up from our region as it relates to surveillance waves.
This collaboration succeeds has now becoming an authority.
Africa CDC in collaboration with African Union.
For instance, we are now collaborating with ministries and member states to integrate systems, especially in early warning systems. For instance, in Tanzania, we are now working with the Prime Minister's office to develop a digital One Health surveillance where various sectors are now able to share events from the community level.
Over a decade,
SACIT has been championing One Health approach to enhance multi-sectoral and participatory approach in early warning and response to health emergencies, of which is a core component of EBS framework of Africa CDC.
Also, when you consider SACIT as a regional networks, it's easy to support mission of African CDC because it has already experience of working in a Southern African region.
Nous avons aussi récemment donc renforcé la surveillance basée sur les événements par un élargissement des sources d'information aux sources communautaires et par la surveillance basée sur la communauté.
We adopted a teach-back mechanism where we supervised the training of event-based surveillance at the national level and also the sub-national levels, including the community level. We also provided technical support in developing or establishing the multi-sector technical working groups to support the operationalization of event-based surveillance at the county level, especially in the Eastern and the Southern Africa.
CDC has enhanced us to build the capacity on developing training materials which are African-centered, and also standard operating procedures and guidelines which has helped our countries on implementation of event-based surveillance.
We have the issue of flexibility and readiness of SACIT to support preparedness and response to public health emergencies, and therefore fitting very well to EBS concept.
This is a platform that we need to sustain. Currently, it's really a platform for surveillance, not for individual countries, but for security in the region. So it's another activity which member states need to participate, but in a structured manner, using framework, guide, and a monitoring and evaluation tool.
Alors, les avantages avec cette communauté, c'est d'avoir des points focaux qui sont identifiés par chaque pays, mandatés par chaque pays, et donc ils peuvent parler des événements de santé sans problème de confidentialité. Aussi, grâce à ce groupe, on se réunit même si on n'a pas d'événement de santé, comme vous savez, le cas 0.
Now we have benefited from networks and collaboration from Africa and beyond, which now acts as a leverage for us in terms of resources and experts, where we are able to share our strength and address weaknesses in surveillance systems.
We really need to model it in a structured way that speaks to health security in our region, as all of us are participating to start prioritizing the aspect of disease that we really need to monitor.
We supported development of a monitoring evaluation plan to support the countries monitor the efficiency of implementation of event-based surveillance activities.
Aussi, ce que je recommande et qui va vraiment permettre de maintenir cette activité, c'est que le point focal ne soit pas une personne, mais une cellule.
It is a platform for member states to exchange information in real time, share experience in implementing event-based surveillance, best practices, operational tools, strategic and work plans that will be beneficial to the member states. This event-based surveillance committee of practice has been established in the Northern, Central and Southern Africa regions, and this year we are working to establish the committee of practice in the Eastern and Western Africa regions.
Great. That is setting the stage for the next couple of presentations that we have. During the Q&A a bit earlier on, there was a question on funding and who would necessarily drive that between partners and governments. And of course, that would have a huge impact on sustainability, on how the EBS framework would be rolled out. Speaking to us about that is Dr. Mohamed Mohamed, a senior public health specialist in the East, Central, and Southern Africa Health Community, responsible in research, disease surveillance, and emergency preparedness activities. And we'll be looking at partner engagement in the rollout of the Africa CDC EBS framework. Round of applause for him.
Thank you. As I was introduced, my name is Mohamed Ali. I am Senior Public Health Specialist from East Central and Southern Africa Health Community. So we are going to give a success story on the supporting the implementation of event-based surveillance. To start with, we just want to give you a few explanation of what is EXA. EXA is the East Central and Southern Africa Health Community. It is a regional intergovernmental health organization that fosters and promotes among member states. And it was established in 1974 under auspice of Commonwealth Secretariat. And then at that time, it was known as the Commonwealth Regional Health Community Secretariat for East Central and Southern Africa. Then it changed into EXA, SG, upon becoming autonomous. Currently, we are having 9 member states, as it was shown. And in our implementation, you can see that we have the member state, I think in blue, and then, but due to our engagement with several other countries and projects, we went beyond the member states based on the different projects which we are doing. And our area of works with the relevant projects, you can see that we are working on the health policy analysis, development and advocacy, harmonization of health policies and guideline, capacity building of human resource for health, and research, dissemination, and repackaging of all this research, including development of policy brief, so that we can work on the policy based on the research findings. And then we have health system strengthening, and we have the control and prevention of infectious and non-infectious disease. This is one of the core. And then monitoring and evaluation of impact health policy, program, and budgets. We have several projects, including the Strengthened Pandemic Preparedness Project, which this is World Bank funded, and it's 5 countries, working with 5 countries. Then we have the Global Fund Regional TB Lab Project. We have TB in Mines project, and these are also funded by Global Fund. And then we have Southern Africa TB and Health System Support, which also is funded by World Bank. In the past, we also have a regional project which was called East Africa Public Health Laboratory Network Project. So coming back to our event of today, we all know that implementation of early warning and response, it's focused on event-based surveillance. So in order to increase the sensitivity of indicator-based surveillance, because we know that if you want indicator-based surveillance to be more sensitive, we really need to have promote the event-based surveillance. And based on this recognition, African CDC, we all know that developed the framework which serves to outline the guide for public health institutes in member states to implement the event-based surveillance. So to achieve this mission, African CDC collaborate with SACID's Foundation and EXA so that we can strengthen the EBS system in the member states. We use the generic guideline from African CDC and together with some sort of capacity building to the part of the member from our organization. Then through that, we are able to prioritize, and right now we are using as a key instrument for the early warning in all our member states. And the other thing is that we were able now to mobilize resources from global institutions like World Bank through our various projects to support member states in the establishment of the EBS system. And our focus was to establish, rather than just to develop guideline, and leave it to the member states. So we want them to actually starting working on the event-based surveillance. So the first task was to conduct a situation analysis on event-based surveillance so that we understand what are the needs. And in various, we have reached several countries from different African regions. And one of the key factors which we wanted to understand were the needed for support, because some few countries we already had started to implement the event-based surveillance system, but we wanted to know what exactly do they know. So out of those, we found like 12 countries requested for development of the strategy. Then some countries, 13 countries wanted to have to be supported the rolling out. Then there's the training of trainers, the community level training, and the development of signals. So these were like the early stages which give us the picture on how are we going, working together with SACID and African CDC to support the event-based surveillance in Africa. So after that, we develop the training modules together with our collaborators, African CDC and SACID. And then first we start with the training module for different levels, and then for various types of event-based surveillance, being the community, facility, media scan, and hotline. Then also we develop the case scenarios. Now those case scenarios which are going to be fit for the country specific. We had also facilitator guides and participants and the PowerPoint presentation. So these all equip us now. We were able now to start going to the member states and support. So we support several countries. As you can see, for Tanzania, we support them in the adaptation of the training materials, and we also conducted TOT training, and we trained 20 health workers on EBS at the national levels, and then we also support, together with our partner, to continue training the 60 community health workers on the community event-based surveillance. So these ones, for us, we are trying to support country at the national level. First, to ensure that they have all required materials, they have all required capacity, and then we support either one step-down training, and then we leave it for the country to continue working on that. For Republic of Congo, we also working together with our partners, and we support the establishment of the multi-sectoral technical working group, and then we adapt the training materials, and we train stakeholders. Since now they were French speaking and the material were on English, so also we work together with our colleagues to ensure that they have the English version, French version of the guidelines. And then we have training 29 individuals from the national, sub-national on how to implement this system. For Lesotho, we had also a very good working relationship with them, so we support at the early stage of the adaptation of the guideline, formation of the technical work group, and we are part of the training of the trainers. And we also came back and tried to review the training materials, and we were working with them to conduct a step-down training. And since we have different projects, the Lesotho support, we drive from another project which called Southern Africa Tuberculosis and Health Strengthen Project. Zambia, there's a lot have been done. We also participate in the review of the guideline, because for Zambia, they've already started with their guideline, but there was a need to review their guidelines, so we worked together, and we did another refresher training after reviewing, And currently we are supporting them on the mobile health event-based surveillance. I'm sure when Zambia presents, they will present into detail on what are doing now on the mobile health event-based surveillance. It is one of the innovation which will help to spearhead a faster detection and reporting of events and signals. For Mozambique is a Portuguese-speaking country. We're also working with them to adapt the guideline, and we did TOT. Currently, we are planning to go back and support them on the step-down training, and also establishing, especially for them, we want to work with them for the cross-border EBS, because as you can see, of recent, there's a lot of cross-border disease outbreak between Mozambique and other countries. So we want to strengthen the early warning system within the border areas. So this is also one of the key innovations which we think will help in the cross-border surveillance for most of the countries. We supported Rwanda on the adaptation of the guideline. We also had the TOT trainings, establishment of technical working groups, and the rollout of to the subnational level. And we actually now working with them to roll out EBS in the high-risk regions, so that we use event-based surveillance to ensure that we target the high-risk region. During that time, it was during the Ebola virus disease outbreak. That's why we wanted to target the area where we think that it has a high risk. We took part during the revision of framework, which also was done here. We provide comment on the draft guideline. We work together with developing the training material, and this time, since we had some reviews and some changes, so we used the new material, revised material to support member countries. Then we also embarked on the mission of digitalization of the EBS. So we had a learning mission in Kenya. Kenya is one of the pioneer, and we thought that we could have taken some member states, our partner, to come and learn what Kenya is doing. I hope Kenya will present their digital EBS so that we can understand. We know that it has a robust system already deployed and operational. We have like 5 country participators, and Kenya was very instrumental in the sharing of their experience with digital EBS. And we had almost all the countries which were involved. They appreciate the advantage of the digital EBS and how has fully utilized. So now we are in the mission to support project countries to roll out digital EBS, as well as implementing some of the lessons learned from Kenya. So we want to thank the government of Kenya for being the spearheading of this and being supportive to ensure that we learn from them. So after that, we're now working with Rwanda and Zambia, so that we want, they already had some initial work which they've already done. So what we want is to support on the area where they've reached, so that to ensure what we are going to do, we are going to develop a mobile web application for digital EBS to reach for the country, as well to connect on their system, the DHIC to integration and reporting and analytic platform. So we are also talking with Tanzania and other countries to ensure that we are supporting them. We also develop a e-learning platform. So we call it EXA Digital Academy, and one of the first topic to be discussed was the EBS. So we thought that we support Tanzania to develop the e-learning platform for EBS, and other countries also in preparation to do. So in a nutshell, this is the journey which we have taken from the time when we start the situation analysis, developing the guidelines, and working together with our partners, and to ensure that we roll out. So our next step is, as it was said, is to mobilize resources from various donors, various projects, so that we support together EBS. We know that there's a lot of initiatives which are going to come out, including the community of practice, and as I said, the EBS at the cross-border and others will come on, but we are also going to be part of it and supporting them. Thank you.
Thank you so much, Dr. Mohammed. In keeping in with the theme of collaboration and partnership, we're about to hear from George Williams from the WHO on that partnership between Africa CDC and the World Health Organization in improving epidemic intelligence on the continent. Can we give him a round of applause? Here he comes.
Okay, good afternoon again. So I'm going to focus on collaboration for strengthening public health intelligence in Africa, and this collaboration forged between WHO and the Africa CDC. So before going into the meat of the presentation, I just wanted you to have an appreciation of what we do at WHO Regional Office for Africa. So I come from the Health Emergencies Program, and within the Health Emergencies Program, we work in a program area called Health Emergency Information Management and Risk Assessment. So it is that unit within the Health Emergencies Program at WHO Regional Office for Africa that is responsible to conduct public health intelligence and epidemiological services for improved preparedness, early detection, and response to health emergencies in the African region. And if you look at there, to be able to deliver on that, we actually structure along 4 technical areas. Public health intelligence and risk assessment, which I lead, but also we have integrated disease surveillance and response, IDSR for short, and epidemiology. We have a team on laboratory and genomics, and another team on information systems and data analytics. So for the sake of this presentation, I'm not going to mention the other ones. I will just stick to public health intelligence and risk assessment. So when we say public health intelligence and risk assessment in the context of health emergency in Africa, this is really what we are talking about. As you know, the International Health Regulation 2005 obligates WHO to undertake surveillance for early detection, to protect, provide, and control against the spread of the international spread of diseases. And so to be able to do that, we undertake public health intelligence at WHO. And basically what we are doing is detection, verification, risk assessment, communication, monitoring and data, information management in humanitarian setting. And when I say detection, I'm actually saying leveraging different processes and tools, event-based surveillance, indicator-based surveillance, One Health surveillance, to be able to pick up any signal at its earliest possible time that corresponds to a potential public health event of national or international concern in our region. And then once we pick up those signals, we collaborate with our member states, with partners, with expert networks to be able to verify if they correspond to true events. We undertake risk assessment. And when I say risk assessment, we actually assess the public health impact of that event, the risks of that event spreading, and the level of capacities that are available to control such an event. And this is very crucial for WHO and her partners, because this information is really used to inform and guide WHO support to member states in response to outbreaks and other emergencies in the region. And of course, we communicate. And this is one of our core obligations under the IHR 2005, including using the IHR National Focal Point Network to inform them of any public health event occurring in the region that might pose risk for international spread of diseases. And of course, we monitor these events. Now, in our region, we also have a number of humanitarian crises due to armed conflicts, natural disasters, or the like. And so when those happen, we do situation analysis. And this situation analysis helps inform WHO and partners to be able to respond to such an event, but also we deploy a number of tools to respond to those events. So, we've been talking about epidemic intelligence, and I just put this slide so that, because I started using the word public health intelligence, so you just have an understanding of what we're talking about. So I use the overarching terminology of public health intelligence because we look beyond the infectious disease threats. We know there are several hazards that are due to chemical, biological, radionuclear, and so forth. So we go beyond just looking at infectious disease threat, which is mainly the component of public health intelligence, which is mainly epidemic intelligence, a component of public health intelligence that focuses on infectious disease threats. So we look more, and that is why I'm using the bigger terminology. We'll go beyond just infectious diseases. But the goal here is actually early warning and response, that we are able to detect as quickly as possible, and we are able to support member states to mount response to mitigate the impact of those events. So, we're talking about collaboration, and one of the first collaborative initiatives I want to mention here is EIOS. I'm sure we've heard EIOS for long. Since we started this day, we've been hearing EIOS. Some of you already know, but EIOS is one epidemic intelligence from open source. And this initiative is being led by WHO Hub for Pandemic and Epidemic Intelligence. This hub was established just a few years ago after the onset of the COVID-19, having realized that there was a need to have better systems, better data, better analytics, better decisions to be able to respond quickly or detect quickly and respond to public health threats. The EIOS initiative is basically focusing on three things. One, to minimize the impact of hazards through improved detection, strengthen capacities for early warning, and support event-based surveillance. So when we talk about EIOS, not just as an initiative, as you've seen, but also is a big community. Since 2017, we've been on the go. And you can see that this community is made out of so many organizations, member states, different partners, different networks coming together to strengthen capacities for early detection globally. And I just want to mention that the Africa CDC is one of the members of this community. In fact, Africa CDC sits on the steering committee, and so we do a lot of collaboration here. And you can also see that beyond just member states, we have a lot of international organizations, local organizations that are part of the EIOS network. In our region at the moment, we've already provided EIOS capacity to more than 20 countries in Africa. And we are hoping that by the end of this year, we will probably reach all of the countries in Africa with this capacity to be able to leverage, to be able to detect outbreaks and other emergencies quickly from open source data. So basically, what are we doing when we talk about EIOS? So what we are actually doing is we are scraping information from the open sources, from the World Wide Web. We scrape that, we geotag that, and then we populate that on a bowl where we are able to visualize and quickly detect any information that may correspond to a public health threat. So this is actually leveraging artificial intelligence, and we are able to pick up anything that goes on the network or on the internet or on the World Wide Web that pertains to any potential public health threat in our region. So this is really a powerful tool that we are using and we're putting at the disposal of countries, and we are collaborating greatly with the Africa CDC to make sure that countries have those capacities. Because we know that most times, the first information about outbreaks and other public health emergencies come through informal networks. Sometimes it's not through the formal health system or the formal structure. So this is really a powerful tool to be able to capture those ad hoc information, analyze them, and be able to detect. And you can see just at WHO Regional Office for Africa, we've created several bowls on this EIOS platform. Over the last 5 years, we've scanned we've triaged over more than 3.2 million articles on this platform to detect signals. So these are different photos. What we are doing is training. I said we've so far deployed this tool to more than 20 member states in Africa. And these trainings are held in collaboration with the Africa CDC. If you look at the photos carefully, you will see Africa CDC representatives. We are really working to make sure we provide this tool to the member states collaboratively. And these are different activities, different training sessions that are being held in different countries. Some of you in the room, I think you can see yourself in some of these training sections. But this is one of the ways we are collaborating with Africa CDC to strengthen capacities for early detection in Africa. The second one I want to talk about, which is familiar to most of you, is integrated disease surveillance and response. You know that IDSR is our regional public health strategy for surveillance in Africa, and this is widely adopted across Africa. In fact, in the WHO African region, 45 out of 47 member states have adopted IDSR. And it has been a marathon from 1998, 3 generations of IDSR. Recently, we had the 3rd edition of IDSR. What we've also done is to assess capacities of countries in the implementation of IDSR. And we see that that capacity really varies from one country to another. Some are weak, some are strong, and some are not comprehensively implementing IDSR as it should be implemented. So a lot has evolved. And with the COVID-19 pandemic, we've also seen areas that require strengthening in terms of IDSR, because IDSR as it is is a holistic approach, it's an integrated approach that encapsulates both indicator-based surveillance and event-based surveillance, but we've seen a lot of weaknesses. And then also COVID have taught us how to leverage technology like genomic sequencing to monitor pathogens, detect antimicrobial resistance, and the like. So we are building on this, and because of those weaknesses and the need to strengthen IDSR, in the region, we've launched 3 flagship initiatives. One of them is called PROS, to strengthen capacities for preparedness. Another one is SURGE, to strengthen capacity for response to emergencies in Africa. And the one I want to talk about is called TASK, Transforming Africa's Surveillance System. This is really geared towards re-imaging IDSR as truly an integrated surveillance system, building capacities for both indicator-based and event-based surveillance. So if you look at this particular task initiative, we've structured it along 4 pillars. Scale up IDSR implementation where we think it is weak. Strengthen data management and informatics, we think it has been a big challenge. One of the weaknesses exposed by a COVID-19 pandemic. Workforce development in IDSR, but also ensure we have advocacy and policy dialogue. And the vision is to really have a stronger integrated surveillance system across Africa, enabling quicker detection and action to prevent and timely respond to outbreaks. So, where does Africa CDC come in here? So, leveraging on this task initiative to reimagine IDSR, to reinvigorate IDSR in the region, we have formed collaboration or partnership with the African CDC, but also with the WHO Eastern Mediterranean, such that we have a comprehensive coverage of the African continent. And we've developed what we call the Joint Emergency Preparedness and Response Action Plan, JEP, which is a collaboration between African CDC, WHO Regional Office for Africa, and WHO EMRO. So what is this collaboration about? The vision here is to have capacities for timely detection of public health threats for response function of the member states across the continent. And the mission is really to strengthen integrated public health surveillance and laboratory systems in all member states through coordination between Africa CDC, WHO Afro, and EMRO. And you can see the objectives for both laboratory and surveillance, but specifically for surveillance, the first objective is to ensure that all member states have capacities to timely detect and respond to public health threats. And the second is to actually establish a functional continental network for data and information exchange across Africa. So there are a number of activities that we've earmarked to be implemented jointly with Africa CDC and EMRO to be able to achieve these objectives, and you can see them there. One is mainly implementing and scaling up integrated disease surveillance, enhancing and establishing epidemic intelligence capacities, which include event-based surveillance, supporting the member states to develop operational surveillance plan, ensuring health information exchange between countries but also partners, and improving data analytics and use. So, before I leave, I just want to show you this, just so you remember what we are facing in Africa. This is last year. These are just new events reported to WHO in the African region. 118 new public health events. Many of the countries were dealing with multiple public health events at the same time. So you can see 35 countries reported new events. That is just on top of many other protracted events that have started in the past year. So this is very huge for our continent. Now, but if you just think about the health emergencies, look at armed conflicts. 11 countries affected, more than 80 million people affected by armed conflicts. In many of these settings where we have armed conflicts, we have infectious disease outbreak. Health systems have collapsed, they are weak. Big emergencies in those countries. Floods. More than 2.3 million people affected in 8 countries last year. Drought in the Horn of Africa. More than 20 million people. So you'll see the burden of health emergencies across Africa is huge. So we take partnership very serious in WHO, and our partnership is anchored on these pro-result values, making sure that we deliver the results to our member states based on our values of integrity, accountability, transparency, but remaining focused technically on our agenda, having responsive strategic operations, but most importantly, effective communication and partnership. We've learned that the response to outbreaks and emergencies cannot be a single agency or a single institutional responsibility. It has to be multi-agency, multi-partner, multi-sector. So we take effective communication and partnership very serious in this collaboration to ensure that we mitigate the impact of public health threats in the continent. Thank you. Merci. Obrigado. Asante sana.
Thank you very much, George, for that presentation and a very sobering map there of Africa. I guess you showed 118 new public health events. last year, happening simultaneously. So when we're talking about collaboration and partnership, it's not a nice to have, it's an absolute necessity. Our next speaker is Gianfranco Spiteri, I beg your pardon, and he will be taking us through the collaboration with the Africa CDC and the ECDC.
Thank you. Good afternoon, everyone. Yes, so I'll talk a bit about how we have been collaborating with Africa CDC around and focusing mostly around the event-based surveillance activities. Hopefully it works. Oops. Okay. Oops. It was too quick. Yes. So as I mentioned this morning in my introductory words, threat detection is a key part of the ECDC mandate, and of course of course with the updated mandate that I mentioned this morning, we have a bigger role. Okay. Yes. And of course with the updated mandate that I presented this morning, ECDC is working more internationally and collaborating more in building international partnerships. And the areas we have been focusing on, especially with the new mandate, is around epidemic intelligence, preparedness and response, and also on data analytics, which we've heard quite a few people mentioning this earlier today. The updated mandate also gives us a bit more focus on improving epidemiological surveillance, and this is maybe mainly in the European setting, but it also applies in our work with Africa CDC, so we can leverage what we're improving within Europe and the experience we have with this new mandate to support the collaboration with Africa CDC. And this work is around the rapid digitalization of integrated surveillance systems, enabling real-time surveillance, further development of digital platforms, and more effective epidemic intelligence and use of new technologies such as artificial intelligence. And most of this we've heard already today and kind of aligns with the plans from Africa CDC and other partners. So the collaboration which we have has been going actually for a couple of years with Africa CDC, and it started in January 2021. So this was even before the updated mandate from ECDC, and we saw that we needed to collaborate more and use each other's strengths, particularly around epidemic intelligence. So the three pillars which we're working together on are around preparedness and response and outbreak response, harmonized surveillance systems, data management, epidemic intelligence, and finally around public health workforce strengthening and training. Within the epidemic intelligence field, let's say, we're collaborating on a number of activities. So to kind of to start from the bottom right, we have been working around training activities, focusing recently on training with R and data analytics. We have worked around joint attendance to key events on both sides. For example, ECDC visited CPHIA and had a side event, presented a side event organized by Africa CDC last December. And we also are working around staff exchanges and exchanges around specific technical meetings. We are also discussing threats on a regular basis, and I'll talk a bit more about that later on. And that's helpful on both sides. And kind of monkeypox was one example, or mpox from our experience, but we've also discussed other ongoing threats. And we're also discussing about developing a mobile application which could support event-based surveillance and facilitate data collection from the field. And connect with the event management platform at Africa CDC. And this is still in the phase of, in early phases of a feasibility study. So some of the milestones which we have had in the last couple of years are listed here. So I think one main point coming out of the COVID pandemic was the ability to again meet in person. And that was, I think, something which hindered us a bit in the first few months before we could travel and meet each other in person. So we met together in Stockholm in May and September last year, where we had very good progress in terms of the activities that we're doing together. In July, my colleague Leonidas joined the workshop on the EBS framework revision in Nairobi here. And in December, as I mentioned, we had a joint event in CPHIA in Kigali. And more recently, I mentioned the ER training, which is actually still going on right now, which initially we were aiming to our epidemic intelligence staff, but then we saw that clearly it would be of benefit to kind of colleagues from Africa CDC, and they have been joining the training as well. One other area where we've started collaborating more and more successfully is around monitoring and assessment. So in terms of monitoring, we're using EIOS, which has been mentioned quite a few times today already, the Epidemic Intelligence from Open Sources tool from WHO for monitoring threats. We have a joint community, ECDC and Africa CDC community there, where we pin items which we detect through our EBS activities on both sides and then share them together. In the middle, this is one example of one collaboration we had where we were discussing a threat which we detected and where we needed some more context and clarification. This was around one of the Marburg outbreaks, for example. And on the right-hand side, you can see during one of the visits from Africa CDC colleagues at ECDC, where Mercy and colleagues joined the daily roundtable where we discuss events which we're monitoring and decide on the public health action at European level. So this is to show that kind of the work has been has helped support both Africa CDC and ECDC in equal directions, I would say. And this is another example where we collaborated, where kind of the input from Mercy and colleagues was extremely useful. This is a rapid risk assessment we published on the Ebola outbreak in Uganda, and Mercy was one of the experts we consulted in the risk assessment which we developed. So of course there have been some challenges, and I mentioned COVID was a big one initially, but now I think we've overcome this, and kind of the ability to meet in person, to be in meetings like this one, for example, and build on the networking is very helpful. We see that timely sharing of information is one area which is kind of very strong value to both organizations, and we will continue strengthening this. And also we kind of on both sides, having this kind of very close link allows us to discuss the context of events, to be able to perform better risk assessments on both sides. So both in the case of Mpox, when kind of the transmission was happening mostly in Europe, we could provide kind of the context to Africa CDC colleagues to understand what is happening and the responses needed, but also for us when events are occurring in Africa. In terms of the way forward, we see a continuous collaboration within this project at an operational level in epidemic intelligence, and this we hope will go on beyond the project. So we hope that this partnership that we've built will serve for the longer term. We will continue to share operational tools and best practices in epidemic intelligence, particularly around one focus which we're developing a lot is around data analytics and artificial intelligence. And hopefully the experience that we have, and we're still kind of learning ourselves, we will kind of share this with Africa CDC colleagues and hopefully more kind of further in the continent. Joint training will continue to be a key area of work, and as I mentioned earlier, information sharing on global public health threats in a rapid and sustainable way. So I think that's it from my point of view. In the panel later on, my colleague Santi will elaborate a bit more on kind of the future of this partnership. So thank you.
Thank you so much, Gianfranco, to George and Dr. Mohammed. Perfect segue into the panel discussion, which will further unpack what we heard in the presentations. I'd like to invite the moderator for this particular segment, Dr. Tebid Victor. He's a curriculum specialist, an educationist, and as well as the executive director of the US-based Partnership for International Education and Innovation. Round of applause for him as he makes his way up. Joining him on stage, Dr. Calvin Sindato is a principal public health researcher, epidemiologist with the National Institute for Medical Research and the Southern African Center for Infectious Disease Surveillance, Foundation for One Health in Tanzania. Dr. Sindato, welcome to the stage. Joining them is Dr. Ahmed Zaklul, who is the Regional Surveillance Coordinator and Global Health Development and consultant with the CDC Middle East and North Africa Regional Office for Event-Based Surveillance. Round of applause for him. Zandi Andrianu, I hope I pronounced that correctly, is an epidemiologist currently working as a scientific officer in the Epidemic Intelligence Group of European Center for Disease Prevention and Control. Kindly make your way up. And two familiar faces from earlier on who gave presentations, Mr. George Williams from WHO, and of course, Kieng Mercy from Africa CDC. Kindly join us on stage as we get this conversation going. I'll hand the mic to you, Victor.
Thank you, Victoria. Good afternoon, everyone. Good afternoon, everyone. Oh, it's a pleasure to be with you this afternoon. We don't have a lot of time. It's a pleasure to be with friends of Africa. We don't call them partners. We call them friends of the CDC. So it's a pleasure to be with friends of CDC. Because of time constraint, I am heavily scripted, which means that I would stick to my script in order to give the audience time to be able to interact with these partners. We have 3 minutes for each of our partners to, participate or say something. This is a conversation. So we would have each partner, say something to us for 3 minutes, and then we will move on. Again, thank you to these very distinguished panelists that are here, Friends of Africa, Friends of CDC, to participate in this conversation. This conversation is actually based and focused on partner engagement and collaboration to foster epidemic intelligence capacity on the continent. So it's a very specific conversation. We would like to start with a question to one of our very distinguished panelists. You know, if you're remodeling a home or you're building a home and your focus is to take care of a hurricane, if it comes, you just want to talk to someone who has been through a hurricane, a storm. So you want to listen to that person first so that you would now be able to see how you adapt when you remodel or build your home. So we're going to start with the US CDC. And the question is, what are key lessons learned from the COVID-19 pandemic and recent outbreaks? How can those lessons inform our ongoing effort to strengthen epidemic intelligence in Africa?
Thank you so much for the question. Good afternoon, everyone. I think for COVID-19, the lessons learned from that were tremendous, starting from something like the vaccination story, from manufacturing the vaccine, discovering it first, and then the distribution of that. This is a huge story, but it's not really related to the topic that we are talking about today. I think one of the huge also lessons that we learned from the COVID-19 is how can the community engagement be very efficient for the early detection and the timely response for not only the COVID, but for any future outbreaks. I think this is one of the key elements from the COVID that we came across, and this has been actually discussed and recommended in too many meetings and too many discussions between partners, not only during or after the COVID, but also before the COVID. So this community engagement is one of the key concepts for the epidemic intelligence, something that we can really detect either through direct engagement with the community, with the healthcare workers or community volunteers, or through call centers or media scanning. I think if you can have a look at the epidemic intelligence part, you can see that all the organizations have came together for the Africa CDC event-based surveillance framework, connecting all the dots and all the sources together into one place. I think one also of a huge improvement and something that we can take from the COVID outbreak is the huge improvement in the digital technology. This has been like quite, I think the achievement for the digitalization of the world in the 2 years of the COVID is like something that we cannot achieve over 10 years. So this is something that has been hugely effective. One of the things that I see very efficient is how the information sharing became like very simple when it came to the reporting of COVID-19 cases and deaths at the end. If we can do that for one disease, why can't we do that for the routine and important public health threats other than COVID? So you could see like a lot of websites, not only WHO, but other websites have been like reporting the number of COVID cases and deaths per country on daily basis, and the numbers have been changing. So if we can do that for one disease, I think we can do that for more diseases, especially here in Africa, where we have like these communities, not necessarily for the whole of the continent, but maybe for certain regions where they share the same important pathogens as Dr. Mirawi was saying this morning, for example. I think that's the main thing. Based on the recent presentations, I think the data information and the real-time data sharing with a platform that WHO have or Africa CDC have for event-based surveillance, and especially with the collaboration between all these organizations together, considering that we have different organizations from Africa, ECDC is attending. So this can be really very effective for the discussion and for the early detection and the use of the experts as a resources for event-based surveillance, starting from the detection to do the risk assessment and sharing resources for the response. Thank you so much.
Thank you, Dr. Ahmed, for being really brief. One very important thing we all got and was highlighted was information sharing. And that I'm sure that EBS falls exactly on that note. Information sharing is going to be a critical aspect of our work in developing all of what the African CDC is presenting today. Next question is going to be directed to the giant, the person who gets blamed each time there is a crisis, the person who we think that never does everything right, even when, they sacrifice everything they have, and that will be WHO Africa. Africa CDC and WHO Afro are technical organizations currently building the capacity of member states on the continent on EI. Which opportunities do you see for stronger collaboration and partnership between regional and continental levels? Oh, that works?
Yes, I think it's okay. Okay, thank you very much. I'd like to start with statistics. You know, as per the International Health Regulation 2005 requirements, 196 member states and state parties are obligated to notify to WHO any event that may constitute an international public health threat occurring within their territory. And so within the African region, we do receive these notifications from our member states. But I must say to you that at WHO Regional Office for Africa, leveraging public health intelligence tools, we were able to detect 45% of all of the events that occurred last year before they were first reported to WHO. And even many of these events before they were first detected by the surveillance systems in the member states. So I see a very huge opportunity utilizing public health intelligence tool, given the expansion we see today in artificial intelligence and digital tools. We know that many of these events that afflict us globally today, many of these reports sometimes emanate from non-traditional sources out of the health system. If we are able to leverage, utilize the goodnesses of artificial intelligence and all these public health intelligence tools to be able to detect outbreaks and other emergencies quickly in Africa, we will be one step ahead of preventing the next pandemic. So I think there's a huge opportunity here for WHO and African CDC to collaborate in building that capacity across the continent, such that we have the real capacities to be able to detect these events as early as possible and prevent these massive outbreaks that we see with so many lives lost. So I think it's a big opportunity, and that is why tools like EIOS, scraping information from open sources, we think this is an area of strong collaboration. We need to work together to put that tool to the disposal of our member state, such that they have the capacity to detect these events as quickly as possible using One Health approach. The other opportunity I see in Africa is in the context of integrated disease surveillance and response. In my presentation, I stated that IDSR is widely adopted across Africa as our public health surveillance strategy. But we also know that in terms of holistic implementation of IDSR, there have been gaps. In many of our member states, IDSR has been mostly tailored towards indicator-based surveillance. And even when we talk about indicator-based surveillance, it's not very comprehensive. In some of the member states, we've seen private sectors being left out of the implementation of IDSR. So with strong commitments from governments across Africa, we think this is really one place we can leverage our joint efforts to strengthen IDSR. When we talk about event-based surveillance, for instance, event-based surveillance is just a component of IDSR implementation. So we're really talking about these opportunities we have now, that this is widely adopted, strong political commitments from government. COVID-19 pandemic has shown the gaps and the weaknesses of our systems. So now this is the time to really come in, collaborate, use digital tools, for instance, to address the issue of information, data management, and analytics during outbreaks. These are places I think we can collaborate strongly to build capacities across Africa. Thank you.
Thank you so much, George. A bigger applause, please. It looks like, yes. So that our friends don't fall asleep, we need to give that applause. Thank you so very much. I mean, what I could pick up, there was a lot that was said, all very important, but you know, there was a reiteration of partnership, involvement of our government, commitment by our government, using the digital tools that are available And I am sure that this event is going to unveil a lot of these tools. They should be used. So again, if we use these tools, we use what we have available, and we, through our governments, are committed, then we see a way forward. The next part of our conversation is going to be directed to someone who's been involved in a lot of work to move us forward towards EI. That will be Dr. Calvin Sidato from National Institute for Medical Research, Sushit, in Tanzania. So you would, push us through this part of the conversation. And it's going to be based on workforce development and capacity. Can you share your approach on epidemic intelligence capacity building across countries? Is there a role of the private sector and the academia in the scale-up of epidemic intelligence? Thank you.
Okay, thank you very much. First of all, let me start by saying that Africa CDC and the SAS Foundation for One Health, where I come from, which is also working collaboratively with the National Institute for Medical Research, share a conceptual genesis in that they both strike or work to enhance early detection, identification, as well as monitoring of acute public health threats in the Africa region. SAS Foundation for One Health is a training and research institute which is founded by the research and the academia member institutions. The founding members involve the members from DRC, Tanzania, Mozambique, as well as South Africa and Zambia. For us, we have been doing a couple of work to enhance epidemic intelligence, especially in the capacity strengthening initiatives. First of all, recognizing the fact that the world is now ever increased in terms of volumes and the spread of travel in situations where you can have a single outbreak in the very remote locations, but just to realize its occurrence to the global scales, we have been investing quite a lot on a community level using two major components. First of all, we strike to address the epidemics at the source, and in this case, our focus goes with a two-mission approach. One is on a geographical context, where we focus at the community level, where most of these public health threats starts. And the other thing is we also focus on a zoological context, preventing the spread of epidemics or pathogens from animals to human populations. And we are driven by our theory of change, where we trust that by investing at the community level, we are likely to have an impact progressively to the national, regional, as well as global health security. So for us, we think if we would like to realize the global health security, we also have to invest quite a lot at the community level. Recognizing as it has been said, that most of the infectious diseases that we are witnessing today have got animal origin, we are also enhancing multi-sectoral collaboration, working closely with the human and animal health sectors, as well as private and the academic research, as well as the academic institutions, in terms of designing and developing African prominent training courses to cater for different levels of health systems, as well as animal and the public health systems. For instance, we have been working with the Africa CDC, where, as our colleague from EXA presented, that we have been conducting the situation analysis to identify the specific gaps to address in order to enhance detection, not only detection, but also sharing of the information. And we think if the public institutes within the region are in a position to detect and be able to share the information, that will also contribute to accessing the information for epidemic intelligence, especially when it is advanced to different platforms. Recognizing the existing trend of high penetration of mobile phones in the region, especially the feature phones, but also the smartphones. We are leveraging on that context, and in this case, we have a vision into developing a mobile app or a mobile tool branded as Afya Data, which we have piloted in Tanzania and Mozambique to enhance early detection as well as sharing of the information right from the community to the global scales. And we are also working to integrate different platforms existing within the different animal and the human surveillance systems. Of recently, we recognize the fact that issues of coordination has become a major challenge. We have been investing in developing the digital platform to enhance information sharing among different stakeholders. We are piloting this within the Prime Minister's office in Tanzania, especially the section that's responsible for coordination for One Health issues. And after we have realized its performance, we will be advancing this to sharing the skills and technology as well as experiences to the other regions of the countries. We have been collaborating with the private sectors in different segments. One is where we approach the mobile phone companies to support like the operationalization of the toll-free numbers so that we can enhance early detection and communication of and feedback loops of any signals of public health threats from the community level. But the other key stakeholders in terms of the private sector that we have been working with is, there are quite a lot of those, but the key ones are those who are dealing with the animal as well as human drugs at the community level. When they see like there is any changes in the frequency of the drug outage or demand from the community level, we take that up as a signal, and that information could be reported into any existing platform or infrastructure so that it could trigger any kind of whoever is going to investigate further what might be the cause of those kind of change pattern. We are also linking the community-based syndromic surveillance. We engage in the academia as well as research institutions in terms of investing in the field deployable technologies to accelerate detection of the pathogens. We have been investing on the nanopore sequencing, that is small gadgets that can be deployed right at the health facilities that are very close to the community to enhance a quick detection. But not only that, as we have witnessed recently, the impact of engaging community in terms of taking the active roles and ownership in the disease prevention initiatives. For instance, when Tanzania we encountered Marburg, we were able to break the cycle of spread quickly by engaging the community to take the participatory role in terms of not participating in activities that could enhance the spread of the pathogens, but also taking things like initiatives of mobile labs as well as technology closer to the community, closer to where outbreaks occur, or closer to where signals have been detected, has been one of the initiatives to enhance generating information and data to enhance epidemic intelligence. Thank you.
Thank you so much, Dr. Calvin. Thank you so very much. My mother advised me when I was young, and she said, the only way you secure your home from a fire is to make sure that you fire trace your neighbor's house. So you can only secure your home from a fire very effectively when you fire trace the homes of your neighbors. Then you can be sure that, when the fire comes, even if it gets to your home, you will be at least able to get out some property. So the next question goes to a very good neighbor of Africa, Europe CDC. I'm sure I said it right. Yeah, I'm sorry? European CDC. So, the technical organizations, Africa CDC and European CDC, share similarities. How can partnership be utilized to enhance their current efforts on epidemic intelligence? In what ways can they be improved for the future? Additionally, how can these valuable experiences be shared between the two continents? Thank you.
So, good afternoon from the European CDC once more. Gianfranco already shared some information about how we have established our partnership with Africa CDC. So we are already in a path that we can improve, we can enhance collaboration, and in this process we don't work alone. It's not only the European CDC and the Africa CDC, it's us, it's our member states, it's our partners that are in the room, and others. So we have to build on what we have so far. We have to build on the challenges and the benefits we have seen. And we have to make innovations, share our tools, share our experiences that is valuable, and understand better how we do threat detection, how we can do threat detection faster, what information we need to share at each moment with each other, how we can share information about the context of the threats we are monitoring, of the events we see in our continents. So each partner, each country, and each CDC can make more informed risk assessments and inform the public. So we have common goals, and based on that, our partnerships can only improve. We have to think about our tools, how we can use them, like EIOS was mentioned a lot of times. It's a great tool. We have to improve it. We have to see what works, what doesn't work, how we can go further. And this will lead our partnership to the future. This will make us be better at our jobs and in protecting our populations. And sharing experiences is a big part of that. We have already been collaborating, so every occasion of collaboration is one other shared experience, and we have to discuss about that. We have to discuss about how individually we monitor our continents and health in our continents, and how we can learn for the next occasion where we have to face a common threat. And that's all from my side. Thank you.
A big applause to Zanti. Thank you for all what you're doing, and we pray that the partnership would continue, and it will continue well. The last part of our conversation by the panelists will be directed to the person of the house, African CDC. What have been some of the gaps identified in the continent in building partnerships around epidemic intelligence? And what is Africa CDC doing to address these gaps? Mercy. You have 3 minutes.
That's what happens when you're the last one to speak. Thank you, Victor. Just so I don't burst bubbles, I'm going to be very quick in the way we analyze this. I know it's a very sensitive issue, what has been the gaps, why we're not engaging, why we're not engaging the way we should as partners, and what has Africa CDC been able to see that has stood as a defiance to this engagement. I think the first thing is we don't know what each other is doing. Before you get into partnership, we need to be aware of what the other institution is doing. I think there's there's low awareness of the different thematic areas that the different institutions are really working on. And the second thing is that we've also noted is the very steep bureaucratic processes in partner engagement on the continent. Sometimes institutions would have to go through several processes to get engaged or to engage one another. Another thing that I feel is also very, very strong, and this is one of the things that cuts across in so many ways, is the lack of alignment in our priorities. So definitely I would not want to get into partnership in an area where it doesn't really align to my priorities as an institution. So basically, as Africa's CDC, we have realized that to be able to break through this, there needs to be a conversation. That conversation needs to happen in the first place. And for the many partnerships that we have had, we have been able to discuss with these partners, understand what their priorities are, or vice versa, and then record what has really been able to WHO forward. We now have a joint implementation plan which aligns to both institutions. Another key thing is around even ownership of the outcome. We jointly do something and then who takes the credit? I think that has been a conversation that has been coming up here and there. And it doesn't hurt for all of us to take the credit because it's actually building a healthy environment and healthy population for the continent. And so some of these things are gradually beginning to be addressed. Like you see, I had to acknowledge EXA with the work we've been doing with member states, SACID, and other partners that have contributed to advancing this work, WHO and all that. And if that is actually spelled out and partners begin to understand that it's a collective effort, then I don't think we're going to have those hitches anymore. Another one before you grab the mic from me is we have so much resources, but these resources are lying dormant. Sometimes these resources are not distributed evenly. Sometimes a partner could be very strong on informatics and another partner is interested and has that particular thematic area and wants to do that, but doesn't have that capacity. How do we ensure that that capacity that is lying in another partner is spread across, like what we did with SACID and EXA, that they're able to advance the event-based surveillance agenda without necessarily going through Africa CDC anymore. So EXA is able now to mobilize funds to go support countries. SACID is able to do the same. But before, that capacity was lying in Africa CDC. And I think it's the same thing that we need to push, and WHO is doing that for IDSR. One institution cannot do it all. So I think there's also that need for us to start looking at sharing the capacity, building capacity across board, not only for member states, but ensuring that this capacity is also institutionalized within the different partners. Let me end here.
Thank you, Mercy. Thank you. You can hear the applause. That's great. Before I get kicked off stage by Victoria, I know she's going to give me an extension. We are going to move. Thank you. Just an emphasis on what CDC Africa was saying. We are in this together. That's what I heard her say. We are in this together. So let's all put our hands together. Let's take the challenges together, and let's celebrate the successes together. So, member states, we are here together. We are in this together, and we will make it together. That's what I heard her say. So we're going to move on to questions. And the way I'm going to do it, I know a few feelings will be hurt. It's not intentional. But because of time, I would want that once a panelist, a friend here has been touched, a question has been answered in that area, we will not take another question in that area. I would want to take questions on 4 different areas. Thank you. And I may be glad if you can point out who you want to,
Thank you very much. Joshua Damsia from EXA Health Community. Mine is directed to my brother at the end, George. Very fascinating presentation, particularly on the epidemic intelligence open source. Could you expound some more on the checks and balances, processes of ensuring that this whole system doesn't fall down on under the weight of fake information, information from the deep web, the infodemic that we are living with at the moment. How do you filter and ensure that what you are picking out from the open source is ultimately genuine? It's an issue I would like you to expand for us, please. Thank you.
Yes. George, over to you. You could always make references to work that is online or some other sport so that we gain on time.
Okay, great. Thank you. So yes, I think this is it's a brilliant question. So the way we work in public health intelligence is that we have both the automated side of things, the machine side of things, which is done by the EROS system, and then we have the human side of things also to triage what is coming in EROS. So basically what EROS is doing is scraping this information from the web. And we have some categories, say for instance a disease name or a symptom, Ebola or Marburg or COVID or you name it. So if there's any information published on the web pertaining to this disease category or different public health threats, EROS is able to pick up that information from the web and tag it to a category. There's some automated processes that go in the background in terms of filtering this information from the web. But then what is fetched from the internet is put on the platform. So also what we do, we have the human side of things where we have a team of epidemiologists who also go and triage that information that has been pushed to the platform. Basically, looking at this information and determining whether this information constitute real signals that should be followed. So we have a number of criteria, for instance, and ERO is also able to rank this information sometimes based on relevance, based on the sources, so the team can be able to follow up and see, and then we check several sources to also complement whether this information is really valid or not. So basically what we are also doing, besides just getting this information from the EROS, we have a team of epidemiologists that's triaging. Because at the end of the day, we reached out to the member states. If we think this is something of public health importance, then we reach out to the member states to verify. So there's a kind of two-step process. What is done by EROS, machine learning part of things, but also what is done by the team of epidemiologists.
Thank you, George. Thank you. It was a tough one and it requires a long answer. So we'll move on to the next question. Yes.
Okay, thank you. Thank you so much, presenters. My name is Philip Ngere from Kenya. Mine comments, but I would beg that George could have counter comments to my comments. Your EIOS is emerging, and indeed, the automation of media scanning, I think, is the best thing that has happened in the EBS space. We are excited about it. However, we're just wondering if it were possible to make it interoperable with other existing systems. We are talking about digitization, like was presented by the EXA health community. And when this happens, then probably we need to have a platforms that are able to speak with each other. The other thing is about domestication of the EOIS platform. As presented, it picks things from the web. And for things to get to the web, it means somebody must publish it. Somebody must have taken note of it, documented it, and posted it. But if you come to the local level, as member states, we are doing community event-based surveillance. And one of the strengths of this surveillance system is that we report things as they happen. We report things real time, and we report things to facilitate rapid response. So if you've got to wait to automate only systems picking things at the web front, then it means there will be some delays. Is there a way we can domesticate this so that we roll it out for use even at the community level, for example? And lastly, it is about the social media platforms. Social media platforms are emerging now, and most information circulates or flows through the social media platforms. And I think one of the bits about EIOS is that it's not able to access some of these social media platforms. So is there a way it can be tweaked so that it's able to speak to these social media platforms? Thank you.
Yeah, thank you so much. I think that he made recommendations, and George is taking note of those recommendations. And some of those recommendations are things we can discuss, during our breaks and things like that, so we can move on. So we don't want to push into some other person's time. So George, if you want to react a minute, you could. Otherwise,
just a minute. I think we'll discuss it. Yes, EIOS is not meant to be a standalone system, right? So there are several other systems that feed into EIOS. EIOS also is interoperable with many other systems as well. In terms of social media, I think you know that on EIOS we have Facebook feeds, we have Twitter feeds, but it's a whole system that is continuously being developed. So such feedbacks and comments are really good and critical, and we can look more into these systems to improve it, to better serve and deliver on what we want to do.
Thank you, George. 2 questions.
All right, hello. Thank you. My name is Lois Olajide from Nigeria, and my question is actually not directed to the panelists, it's the previous presenters. So I don't know if I'm allowed to actually, raise my questions.
You could raise the discussion with the presenters that did the presentation during the break.
All right, okay.
Yes, you could actually
but
talk
it's
to
actually them. It's also, a point.
Yeah, you can make a statement and then
all right, thank you very much.
Yeah.
So it's actually with respect, when the last person was, the last panelist, she was talking about different, partners, countries not being aware of what the other countries are doing, not being able to collaborate. Actually, and I think that this is actually a very good forum. And so I want to share the Nigeria's experience. Yes, I know Nigeria has not been one of the countries, supported by African CDC, especially with respect to, deployment of EBS. And so we are at the level whereby, yes, we have a functional EBS at the national level, and we're at the level where we want to deploy and ensure that we have the system in all the states and also in the community-based surveillance, actually in all the LGs. So my point now is, especially with respect to one of the presenters asked, made a presentation on the EBS and then the mobile application. So my question would be, yes, even though we've not been supported, is African CDC willing to support Nigeria, especially when we have the plan to have it in all the states? We have 36 states and FGD. And also on the issue of the interoperability, yes, we've also mentioned the interoperability of EIOS. So is this mobile platform, is it interoperable with other platforms that are, in country? And then my last point is actually on this, the EEBS. So what's the plan? Yes, we want to deploy to the states, but it would be good if we can have the EBS developed such that even before we go and have the formal training, individuals can, they would have an idea of what it's all about. They would have gone through the modules and have a fair understanding of what the system is before it is actually deployed at the subnational. Thank you very much.
I think as we said, this discussion will continue. After now, there was a hand here. That will be the last hand I will take.
Okay, thank you. I'm Adeline Kabeja from Rwanda. My question is for WHO or Africa CDC, or both can respond. So what we know, I would like to know what is recommended to countries in regard to the digitalizing EBS. Actually, in IDSR, third edition, the only electronic system that is recommended is the EIDSR. And as we know, it is for indicator-based surveillance. But we are moving to EBS in order to complement the indicator-based surveillance. Africa CDC is promoting EMS. But until now, WHO doesn't say anything about EMS. Could we take this as a standard for African countries, and so that we can move ahead with implementing EBS with the electronic system that is EMS? Or can we wait another recommendation from WHO? What do you recommend? Thank you.
Thank you so much. I mean, fantastic question. And let me just start by saying that EIDSR, EMS, all of those are on the same digital tool, which is the DHIS2 platform. Okay, so we are moving from not only looking at event-based surveillance sources, but also looking at both to guide early warning. So the ideal is having an event management system that pulls data from the EIDSR, and that is what some countries have done already. So you're able to set thresholds for each of the priority diseases that you're tracking. So once the disease you're tracking exceeds that threshold, it comes out now like a signal to your event management system. And you're able to see that in real time, and you're able to respond. The same as signals that you're picking from other non-structured data sources. They stream through the event-based surveillance platforms to their event management system. So your event management system now is not only managing signals or events from non-structured data sources, like the event-based surveillance, but also from structured data sources, like the EIDSR. I think the proof of concept will be shown by Uganda, who are trying to do that. I think recently, Egypt also reached out to us to help them set those thresholds. And that is the way to go for early warning. You don't want to rely on just a single source to inform your preparedness and response processes. Does that help you? So it's the same, it's a DHIS2, and EIDSR is supporting your structured data. Now, you need to ensure that you're also using that data coming from the EIDSR to support your early warning functions. So how do you do that? You need to set thresholds so that when it gets to that level, it comes out now as an alert, right? Or depending on your processes. And that now has to go to a system that is able to manage it. You have to go back to see if it's a mistake in the system. You have to verify that information. You have to confirm it. And once that happens now, you need to do your risk assessment. So there should be a system that you're able to process that data that is coming in. The same as the data that is coming from the event-based surveillance sources. Remember that the event-based surveillance sources could be multiple sources. You could have it from the animal health sector. You could have it from Twitter, from social media. How do you ensure that you're pulling this alert even from the EIUS, which I think Zambia has been able to do that. They're able to link the EIUS to their event management system. You're able to pull this information into the event management system. So the event management system is helping you to process early warning data, both from both sources. So you need to ensure that there is that interoperability. And the good thing about the event management system that we have is that it's developed on the DHIS2 platform, same as the EIDSR. So the interoperability is already seamless, like you don't really have issues with interoperability anymore.
Okay. Thank you. Can I?
Dr. Yenu, this is an indication that this conference needed to be 4 days. So we're just saying we need another conference to come up sooner. Yeah, a minute.
Yes.
And just before. Now, once Kevin makes his remarks, and then we're going to move on a minute each to the panelists to close this. So you do that with your 1 minute.
Okay.
So you have 2 minutes here.
Yes, good, thank you. So, what I want to say is that, again, when we think of IDS error, we should look at it in an integrated context. And I think this is what I mentioned from the beginning, that most time, and in many places, we've been implementing IDS error as indicator-based surveillance, when in fact, IDS error encapsulates both indicator-based surveillance and event-based surveillance. So when you are thinking about systems or tools to manage that information, what we normally advise is that whether you use indicator-based surveillance to detect or you use event-based surveillance to detect, make sure that you are able to pull this into one system. You could call it EMS, there are so many different platforms that is used in countries for that. But the point is, event-based surveillance is not a different system from IDS error. Okay, event-based surveillance is complementing, is part of the IDS error system, just is complementing indicator-based surveillance. So the event management system is actually a system where you manage events from detection. For instance, in WHO, we use EMS, event management system, and we manage that events from detection up to the point the event closes. So we manage from the time we detect the signal to when it becomes an event to when we conduct risk assessment and all the different response actions we manage in the event management system. And so maybe I think as we go along, this might be very clear to member states so that they have a very clear guidance coming from Africa CDC and WHO on how they can do this. But I think you should not be confused about this. And to close, so I have said that the COVID-19 pandemic has taught us the need to collaborate, the need for strengthened partnership, the need for epidemic intelligence to be able to detect events that pose public health threats today. And I don't want to overemphasize collaboration. It's really key. If we must keep our continent safe, we need to partnership, we need to collaborate at all levels, at national, at regional, and at global levels. Thank you.
Thank you, George. So, over to Zanti, European CDC.
I'm not sure how much more I can emphasize collaboration after George's remarks. We have to continue in this path, and that's what comes from this forum, this meeting, and we have to continue speaking about epidemic intelligence and how we can improve.
Thank you.
I think out of this meeting, the most important point that I want to raise is that the overall vision is the country vision. The country. I think that the country is the one to lead how they want to involve event-based surveillance, how they want to implement event-based surveillance as part of their early warning system. How can we link between that and the currently available indicator-based surveillance? It's not about one system replicating the other, it's about one system complementing the other. So the vision for each country is like, where do we want to start? How do we want to put that together? Where we want to start, like, do we want to go directly for something like engaging of the community through community volunteers? Or do we want to start with something more simple like the media scanning component? Do we want to address like the One Health approach, or we want to start with something more simple like the human part? The idea is, as a country, you can put your implementation plan and your integration of event-based surveillance inside your country, and then you will find a lot of support, as you can see here in this forum and in this meeting, that many organizations, either locally or regionally or internationally, can really support the countries. So once a country has a very good vision for what they want, I think this can be like the starting point for achieving something for that country. Thank you so much.
Thank you, Dr. Ahmed.
Thank you very much. What I would like to emphasize is that investing at the community by empowering them with the technology-driven EBS is likely to provide a lot of opportunity to enhance early detection as well as reporting of any signals of public health threat. But then again, linking this syndromic surveillance or community-based surveillance with the laboratory networks, especially adopting the deployable approaches to deploy diagnostic facilities closer to the community will enhance early identification of pathogens. And in this case, we will be able to respond more efficiently to the identified pathogens. Thank you very much.
Thank you, Dr. Kerr.
Thank you so much. My final word is just to reiterate that collaboration has to be intentional. It is not, you don't just sit and wait for others to commit you, but it has to be an intentional decision to ensure that you are not duplicating efforts. And this is not only about collaboration at the continental or regional level, but even at country level. Before we start the development of a new tool, have we done a mapping to ensure that a different stakeholder has not developed this, or it's not lying, the same tool is not lying in another sector that you could be replicated and just scaled? So it has to be intentional. We need to really go deep dive to understand what exists, just so that we don't keep reinventing the wheel. Thank you.
Thank you so much. A big applause to these panelists. Okay, my last word. When, as a family member, if you're given the responsibility to share very scarce resources to the family, you end up in trouble because you end up not giving enough to each member of the family. So I want to apologize for those who didn't have enough time, didn't have the opportunity to ask questions, to express themselves. Now, one last thing. As a US citizen, I knew that I had the strongest army behind me, my back. I had the most powerful economy in the world. I had the best healthcare in the world. Yes. So as a son of Africa, every night I went to bed, I prayed for good health to my parents, my siblings, my family. I was the one praying for them because I knew that if there is trouble, they will be the first to go. Until COVID-19. When my family back in Africa started having meetings to pray for me, because I was most at risk. The nuclear arsenal couldn't help me. The strongest military in the world couldn't help me. My siblings started saying, "Can you come home?" I said, "No, I'm a US citizen. I believe in the blue, white, and I believe in the stars. So I'm going to stay here and I will die." Now, what am I saying? If you didn't take anything home from here, you should remember that we are in this together. There is no giant. No giant. If you think you're the giant of Africa, think again. I'm talking to member states. If you thought you were a giant of Africa, think again. Because I was the giant of the world. But everybody had to pray for me because I was the most at risk. So we have to partnership. We have to collaborate. That's the take home. The greatest, the most powerful became the most vulnerable. It takes a village to raise a child. That's what my forefathers said. It takes a continent to protect us all. Remember, partnership is not only between states. Partnership is even within your various countries. It is not something of the Ministry of Health, the big people, the cattle people, the farmers, the Bayam-Salams, partnership and collaboration. Thank you very much. Big applause to these wonderful people. It was a privilege to be in your presence. So sorry. I hope you don't kick me. Thank you.
Can we give a round of applause to our fantastic panel moderator, Dr. Victor? And extremely profound words, definitely food for thought. And on that note of food, we're about to go into a health break. We are slightly behind schedule. So I want to suggest, if I can take liberty as a moderator, Mercy, to make this a working health break. So if we can head out, get tea, come back, and do that in 10 minutes. Fantastic. And then we can continue. We have 2 more presentations and then the very critical regional engagements, which will be happening just before 5 p.m. So we can break for the health break. Tea is being served outside in the next 10 minutes by 4:20. If we can be back here, that would be great. Thank you so much.
In 2001,
check, check, check. Check, check, check.
kitendawili hapa. Inaweza kuwa ile extension cable zenye watu wana connect huko na kama kuna wengine mahali. Una socket tu.
Unaipata? Okay. Kuna kelele?
Kind request for attendants still outside to make your way back in the room. We're just about to begin the final session. One last call to have attendants return into the room. We are about to begin the last session. Thank you. Final call, final call. Kindly make your way back into the room. We are about to begin the last session. Final call, final call. Kindly make your way back into the room. Thank you. Okay, thank you for those of you who were able to join us. This is the final stretch. I'd like to invite Dr. Balaji. She's currently the Senior Technical Advisor for Surveillance and Pandemic Preparedness at the Global Fund to Fight AIDS, TB, and Malaria. She'll be talking about EBS, a key area to improve health security globally. Can we give her a round of applause as she comes to make her presentation? Thank you.
Good afternoon, everyone. Thanks for coming back after the coffee break. It's always hard when you come back and it's late in the evening. So my name is Arun Balaji. I will be speaking in the next couple of minutes a little bit about what the Global Fund is doing in the area of early warning surveillance. But I also want to thank all of you here. I'm very grateful for this opportunity. It feels like coming back to the family. Previously, I've done a lot of work around early warning surveillance, so it's great to be here. I want to start maybe with a question, with a poll really. How many of you in the audience, this is just a yes or no question. If it's yes, raise your hands. How many of you know that the Global Fund only supports HIV, TB, and malaria? It's not a trick question. Yes? How many of you know that the Global Fund only supports HIV, TB, and malaria? Okay. How many of you know that the Global Fund supports health systems and pandemic preparedness? Okay, that's fantastic. A great start. Thank you very much. So that is correct. Most of you were correct that the Global Fund is a new player in this area. Traditionally, it supported HIV, TB, malaria pandemic, supporting health systems around HIV, TB, and malaria. But now, the last couple of years, starting 2020, the Global Fund has also received funding through what we call the COVID-19 RM mechanism, the C19 RM mechanism. The Global Fund was awarded $4.7 billion US. Of course, April 2020 is when the Global Fund received funding. All the 125 countries or applicants are eligible to receive this funding and have received funding from 2020. When the funding was released, the objective of the funding was to mitigate the impact of the COVID-19 pandemic on programs such as AIDS, tuberculosis, and malaria. It also included funding for the countries to initiate urgent improvements in formal and community health systems. You fast forward rapidly to last year. We all talked about the learnings from COVID-19. We learned that a lot of the improvements and the investments that the Global Fund put to countries in 2020 were no longer required or no longer used by the countries, largely because the pandemic was evolving. And so in November of last year, the Secretariat in the Global Fund, recognizing this evolution of the pandemic, requested the countries to start reinvesting the dollars that it already received or can receive new funding towards health systems preparedness and pandemic response and surveillance. And the time frame also was extended to 2023 to 2025. Originally, the funding and the investments were supposed to close out in 2023, but now we have an extension till 2025. Now, what does that mean for countries or applicants? So here is, at the bottom of the slide, the 4 areas that the countries can either reinvest or ask for new funding. The first one, the first box over there, is surveillance system strengthening. And the rest of my conversation with you will be actually what parts of the surveillance systems we're requesting countries to strengthen through Global Fund investments. Improvements in laboratory and diagnostics, human resource for health and community strengthening, medical oxygen, respiratory care and therapeutics, health product and waste management systems. You will notice right away the first 3 boxes, they're very similar to the investments that Pandemic Fund from the World Bank is asking countries to make. So I want to pause here for a minute to say that Global Fund is separate from the Pandemic Fund, although the initial funding requests from both partners are to strengthen early warning surveillance and early warning, early detection. So here we're getting into what are the parts of the surveillance that the COVID-19 funding through the Global Fund can support. So like we talked about, we're encouraging countries. We recognize the WHO has formally not called an end to the pandemic, but we're also in recognition of the fact that the countries are transitioning from the response to COVID-19 to more the management of COVID-19. We're encouraging countries to move from the response to recovery and pandemic preparedness, with the recognition that both of it requires a renewed focus on health system strengthening and investments in systems that can help the countries transition from the current pandemic, but also prepare for the next pandemic. And so we recognize that the investment should go into core system strengthening, because without health system strengthening, there is going to be no pandemic preparedness. So we're encouraging countries to invest in health system strengthening. And sorry, before we get into that, this is a publicly available information. All of this information you can find if you Google C19RM technical information note. This just released about 2 weeks ago. It's publicly available. And this gives you, so Global Fund doesn't release guidance. We leave it to WHO and other technical agencies to release guidance. But this is an information note that lays out the eligibility criteria for the countries to request funding for the surveillance system strengthening. So we heard all throughout today how we have to collaborate, how surveillance is surveillance, but we also recognize surveillance has many objectives. And here we're asking countries to really think about the objective of surveillance that includes early warning. And again, this is just a very busy figure, but it's just an illustration. It doesn't have all parts of what we're talking about. I encourage you to look to the WHO guidances, but also to the Africa CDC frameworks and our own technical information note. But there's just an illustration where we want to emphasize that early warning surveillance is health system strengthening, but also system strengthening. No parts of this can stand alone. Every part of this has to work together from the primary healthcare center all the way to the national level. We heard a lot about event-based surveillance, integrated disease surveillance and response systems. We're hearing about EMRO's integrated disease surveillance. WHO has a new initiative called collaborative surveillance. All points to the fact that we work together in every part of the public health units in the country to enable early warning surveillance. So as an illustration, on the yellow box, you will see the idea and the concept of event-based surveillance. We heard a lot about communities. Here we strengthen socially connected communities, not only community health workers or your village health volunteers. We heard, we saw, and we experienced how COVID-19 spread within congregate settings and socially connected communities in urban, peri-urban, and rural areas. We're encouraging countries to enable event-based surveillance, and it's represented in figures here on the yellow box, socially connected communities. Encourage school participation, universities to participate and not stop only at the community health worker level, but broader health system strengthening that includes communities as well as health facilities. We heard this morning that private care facilities have been left behind, and during COVID-19, they were the organizations who stepped forward, whether it's for lab diagnostics or for COVID-19 case management. So we need to consider in event-based surveillance a broader stakeholders at the country level to make this happen. We include indicator-based surveillance. In Africa, we recognize its integrated disease surveillance and response that includes the Africa CDC framework. And so both of this working together at the primary healthcare level, at the district level, where it's enabled to collect the data, do risk management, and respond. And then as well as the laboratory, the genome sequencing initiatives, all these initiatives that we learned during COVID-19 has to come together. The data streams have to come together, and is represented by this box here, whether you come together in a National Public Health Institute, whether it comes together in an emergency operations center, or anywhere. The capability and the capacity for the data from the laboratory, for the community health systems, from wherever, comes together and the capacity to look at this data, to analyze and interpret, so response can be guided by that data. And so basically the slide just puts together that the more complicated slide. We think indicator and event-based surveillance linked to laboratory systems, connected by data systems and data use are key components of early warning surveillance, not only at the national level, but every level below the national level needs to be strengthened for all these three components. And that's how we achieve optimal early warning surveillance. So like I said, Africa CDC is to launch its event-based surveillance guidelines. IDSR has its 3rd edition. But we also have other companion guidances. This guidance just released 2 weeks ago. This is from the WHO group that does epidemic preparedness, and they also manage the coronavirus and influenza pandemic response groups. So if you look at these two blocks here, they call it the mosaic. You have different tiles of the surveillance that all have to come together to achieve different surveillance objective. If your surveillance objective is early warning, if your surveillance objective is to detect an outbreak, then domain 1 is what they're calling it, will do it for you. And in domain 1, if you look at the top of it, like I said, it's not only communities, but socially connected communities, health facilities, laboratories, all working together to make sure that an event, when it happens early, is detected and responded to. So there are other domains as well that forms part of these mosaics, but the tiles for us for early warning surveillance then becomes strengthening health community level and laboratory networks. So this is also available publicly now, and on the right-hand side is the emphasis on health facilities, communities, and laboratory networks to make sure the early warning surveillance works optimally. So again, this is just, I'm not going to go through this. You will see this in the technical information note, but basically the Global Fund is asking countries to invest in surveillance, which includes event-based surveillance, as we talked about, indicator-based surveillance, systems that can manage events, indicator-based surveillance like sentinel surveillance systems, and IDSR. Laboratory systems, especially systems that can transport the specimens, characterization of epidemic-prone pathogens, as well as laboratory and epidemiological linkages that can allow an early warning surveillance system. We talked about data reporting. It's not only important to report the data, but to realize that the data streams have to come together, capacities to analyze the data, and the capacities to use the data so that the response can be guided by data. Of course, workforce is very important. We consider FETP as a core workforce development initiative, but also consider training, which is beyond FETP at every level, so that early warning surveillance can be an integrated component. Not only do we train in indicator-based surveillance and event-based surveillance, but train together in early warning surveillance so that at every level they understand how each of these systems contribute to early warning surveillance. And of course, response, we recognize that when countries have a strong surveillance system and not enough funding for response, then that doesn't really support early warning surveillance and response. We're asking countries to ask for and receive funding to enable correct responses to the events that are being reported, but also include simulation exercise as a way to exercise the early warning and understand the early warning components in these countries. This is my last slide. Collaboration seems to come out of the last panel very clearly. And we are very collaborative here in Africa. We're working already with Africa CDC and WHO. We can't stand alone here. And with all the member states to implement early warning surveillance. We were part of the revision of the Africa CDC framework. We are in the member states investing in the TAS WHO framework and in the Africa CDC framework in the countries. We're also actively working with WHO Afro and Africa CDC to second people in both of these regional offices, recognizing that in order to implement the vision of WHO Afro and Africa CDC, they need the workforce to support this implementation in member states. So we're also supporting seconding of staff. So we're collaborating not only at the member state level. I'm sure those who worked at the Global Fund knows that we work deeply and closely at the country level. It's a country's plan, we like to say, never the Global Fund's plan. So we also want to elevate this so that WHO Afro and Africa CDC can also work with the member states to enable and implement early warning surveillance at the optimal level. So I want to say thank you very much to all of you to listening to my my presentation. I'm available after this to have any questions answered. I also want to thank Africa CDC for inviting us, for collaborating with us, especially Dr. Yenu and Mercy for really inviting me and giving this, this forum to make this presentation. Thank you very much, everyone.
Thank you so much, Dr. Balaji, for that extremely detailed presentation. As she said, if you can find her, maybe after the sessions, she can take you through a bit more. We're about to get into the final presentation, which will be led by Moses Bamuture, who is the data manager at the Africa CDC. And he'll also be accompanied by Chika Chidinma, who will also take us through that particular session. If you can take about 15 minutes for that, and then we'll move into the regional engagements. I'll take you through how that is going to flow. A round of applause for Moses.
Thank you. I think it's already evening. Good evening, ladies and gentlemen. All protocol observed. I believe that I won't make us sleep or doze, and I will keep our presentation short. My presentation is regarding digitalization. As you all know, the mandate for Africa CDC is to strengthen health systems on the continent through the National Public Health Institutes. Yeah, so I'm going to present an overview of the event management system, which has been developed by Africa CDC with the support of our friends, HISP South Africa, who are also here, to see how best we can support member states in the initiative of early warning detection. Yeah, so Africa CDC, as you all know, started in 2017. Yeah, but we are running. We came to a field which needs our support as quickly as possible. And after realizing that the continent is facing a lot of pandemics, we thought that it would be very paramount to provide sufficient support to the public health institutes to promptly detect, respond to the recurring public health threats that have been happening on the continent. Yeah, so it is to that aspect that the Africa CDC established an epidemic intelligence unit and under the surveillance department to easily support member states in implementing early warning systems, starting especially with Africa CDC and also with the member states. And Africa CDC has developed a number of tools. As you can see, one of the reasons we are here is to celebrate these tools that we've been able to develop, the event-based surveillance framework, the training modules, and most recently, the event management system, which I think most of the panelists that were here have spoken about it. Also, its level of integration with IDSR. So the Africa CDC event management system is an electronic platform which is developed over DHIS2. DHIS2 is a District Health Information System version 2. And the reason why we chose DHIS2 is because of its level of agility and its level of customization, its open source aspect, and having an all-inclusive platform that can help you to collect data from remote areas, analyze this data, and also be able to report it and visualize it. So it is a very powerful tool. Being open source means that its source code is available for contribution by the public, and therefore member states can always ride along it and use it without any payment. So the advantage is that you will not need to pay the recurring licenses like the common proprietary systems that some member states have adopted, and you find that maintaining them becomes a challenge. So we also found that DHIS2 is being used by over 70% of the member states for their health information systems. So for interoperability, this was a good platform. Yeah, so we have used the event management system at Africa CDC level to collect different signals and events, and these are collected on a weekly basis. We plot these in the system and analyze them, and they help us to be able to provide support to the member states. This system has been piloted now for over 2 years, and as we move on, I'll be able to show you some of the results that have come out as a result of the analysis and the signals and events that have been collected. So for any system to function, you have to feed it with data. So the event management system is a tool that is basically digitalizing event-based surveillance. And the data that is coming in, or the data that is collected, we are using different kinds of sources. As you can see, we use formal sources and informal sources to be able to collect all this data. And this data is unstructured. So we use DHIS2 to be able to analyze this data and come up with different reports. We are also trying to integrate it with different tools that can help enrich its level of signal detection. And most recently, we have been able to integrate with EIOS, that is Epidemic Intelligence of Open Source platform that was developed by WHO. This has been talked about a lot, so I cannot speak much more on this, but it is a very robust tool that uses artificial intelligence to be able to detect these signals from multiple sources and bring them together. So you can easily use it to flag out different signals and events depending on the data that has been provided. Yeah, so earlier I mentioned that the EMS is coming in to digitalize the different steps that we do in event-based surveillance. So we have been able to digitalize from the level from the time a signal is detected to the time that there is risk assessment for that signal until we hand over to the response team to be able to respond. So we have signal detection. There is a component that we use in the EMS to record all these signals and events that come in. And then when these events are detected and recorded in the system, there is some level of triage and verification. And once that is done, these signals can either be discarded if they are just common rumors, or they can translate into events, and then those events are tracked over time until that the event is closed. And over time, the risk assessment of the events are conducted still in the same system to evaluate the public health impact and also assess what level of response should be accorded to such an event. So these are the steps that we follow. These are the standard steps that we follow. And we've been able to automate these steps in the event management system. Now, what you see here are some of the applications that exist in the event management system that we are riding along to be able to automate the steps that I've been able to highlight before. So the whole process starts with signal detection. I mentioned that we use different kinds of sources to detect signals, but at the same time, we are also riding along EIOS based on its data that we are able to pick. So once these signals are detected, they are captured using different apps. That is the data entry app, the tracker app, and then they are recorded in the DHIS2 platform. And thereafter, we start tracking the different signals and events that have been entered. And at the end of it all, you are able to visualize this data using different dashboards. But at the same time, you can come up with different forms of reports that you can share internally or externally. What you see here are some of the reports that we've been able to customize in the event management system. These are standard reports that you're able to generate at a single click, and you're able to use internally for different meetings or even externally, depending on the operations of the member state. So you're able to plot where events are taking place, and you're able to do an analysis and give some reports on the specific events that are happening in the country. And for Africa CDC, we look at the events happening at a continental level. And this can guide how you're able to provide support or response that might be required for specific events. We're also able to develop different briefs, and as I mentioned earlier, the EMS has been integrated with different tools. On the left, there is a dashboard there is an Africa CDC dashboard, but on the right here, you can see a COVID-19 brief. So you can develop briefs for specific events of interest at any time you may want to track any kind of event. Yeah, so I mentioned that we've been able to pilot the event management system for over 2 years now. And as of 2022, the EMS started in 2021. As of 2022, we are able to receive data from 47 member states, and a total of 315 events have been detected, whereby 77 of them have been human events. So the EMS is developed with a One Health approach so that it can be able to collaborate with the different stakeholders from the animal sector and the environment sector, considering that these diseases come from all these areas. So when you have information from all these sectors, you're able to understand the exact source of some of these diseases. That's why we are able to detect events and signals from all the sectors highlighted. Yeah, so we have found the EMS to be a tool that member states should ride along to automate their event-based surveillance processes. And as a result, Africa CDC has started supporting member states to adopt the event management system to the national level. And we are supporting member states to customize the event management system to help the different member states to be able to use the EMS to detect events at the national level. And in the picture there, you can see it's one of the adoption meetings that we're having with the Republic of Zambia as we are trying to support them in adopting the EMS. And we have had several meetings of this nature with the countries listed there to ensure that we support them. And we hope that this can be cascaded to the rest of the member states to support them in automating their processes of collecting these signals so that they can quickly receive these signals and respond. When there is an event that happens in a country X and we detect it late, the response, the effect of that disease or event might be more catastrophic than detecting it earlier. So what are we recommending as Africa CDC? We are recommending that member states should be able to deploy digital systems to easily or to timely detect and respond to these diseases that happen on the continent. We believe that if we all apply the same approach, then that we shall be able to decrease the number of diseases that are happening and therefore also ensure that there is little death that is happening. So I thank you all for listening to me, and that marks the end of my presentation.
Thank you. Thank you so much, Moses. And that wraps up the presentations for the day. We want to quickly get into the regional engagements. And these will be, for lack of a better term, self-moderated. So we'll split the room into 5 regions, if you will. And we have them in 5, Central, Eastern, Northern, Southern, and Western. So the way we will do this is we'll have the Eastern region in the far left corner, Western region right here next to the stage, and then we'll have the Northern region far right corner, and then Southern will be right next to the stage to my right. Central, for obvious reasons, will be in the center, and we will have Dr. Severin lead the Central region group. Bethlehem will lead the Eastern region group. Fatma will do the Northern region. Chika will do the Southern region, and Marianne will lead the Western region. So once again, we'll have Eastern region to the far left. Closer to the stage will be Northern region, Western region, and then we'll have the Northern region to the far right of the room, Southern region, right next to the stage to my right. Central will be at the center of the room. So if we can run those up until 5:30, that will be fantastic. And the respective leaders for each of those groups to lead you through the regional engagements. And we'll be wrapping up the day. Thank you all. Fantastic. So a quick announcement, those of you who are not going to be part of those regional groups are free to leave. And we'll reconvene here at 9 a.m. tomorrow for the official launch of the EBS framework. Thank you once again for your patience, for your interaction and engagement, and we'll be back here tomorrow morning, 9 a.m. sharp.